When it is time, खोलो।
हाँ खोलो वरना ये रहा। Okay.
You, sir, and I request you to give the address of guest.
Thank you so much for inviting me this International Nurses Week, especially this day, the fourth webinar which is being held in this context. I really uh, thank the organizers that they have chosen such a topic which is very much relevant in these times, that is artificial intelligence. So this artificial intelligence is basically a double-edged sword, which can help us and destroy us too. Helping can be in many fields, especially in the field of medicine and nursing, especially from sample to the result. It can be very helpful. You don't need any human intervention in this, and it is totally automated, robotic, and you get the automated results on your own. So this is how artificial intelligence is playing a role in our day-to-day life and in the medical life also. So, but since I said that it is a double-edged sword, this artificial intelligence, just a couple of days, I was reading in the newspaper that a humanoid, that is a robot, which is very much like a human, tried to attack its mentor, that is the person who made it. So, with this keeping in mind, we should never forget that natural intelligence should always prevail over artificial intelligence. We should never be beggars in front of artificial intelligence, because more and more we go towards artificial intelligence, more and more we will not use our brains. And that is where you start lacking in your IQs, the brain activity will become less. So that should not happen. So with automation and artificial intelligence, it is very necessary that you should know the manual methods of performing nursing jobs or medical jobs as such, so that if at times there is a breakdown or shutdown of these kind of machines, we can certainly take care and proper care of our patients, which should not suffer due to totally based on artificial intelligence. So, with these few words, I would like to end here and once again thank the organizers that they invited me for this welcome inaugural session of this webinar. Thank you so much.
Thank you, Dr. Prashant, sir. It is a eye opener for all of us every time when you give insights, and you have been always a mentor to us, to the entire nursing community, and we are so blessed to have you here. And thank you so much from our bottom of our hearts. Thank you. Now, allow me to welcome Professor Dr. Rajesh Harshvardhan, Deputy Medical Superintendent, Apex Trauma Center and SGPGIMS. Sir is also the head of hospital administration. Sir being a pillar of support for more than a decade for nursing services here in the SGPGIMS. I welcome you, sir, and I request you to give your address. Thank you.
Good morning to all of you, my seniors by my side, organizers on my right side, and audience available online. There are online audience available. I don't know whosoever has conceptualized this theme, artificial intelligence in nursing, is something which is very apt, has come of age, it's need of the hour, and is way forward future, is future compatible concept. The way advancements are being made in different domains of healthcare delivery since the advent of the first computer, the punch computers, then supercomputers, then artificial intelligence, then machine learning, between robotics as well. It is gradually revolutionizing the way the healthcare is being delivered. Now, at SGPGIMS, a forerunner institute in the nation and widely known across the globe as well, the nursing division has thought of this topic, has thought of to deliberate upon this domain vis-a-vis its implications or its use or its invocation, service delivery is really praiseworthy. At least their thinking, their thinking is at par with the current best practices in the globe. Repetitive tasks were already being used or being delegated by two different machines or gadgets. Now the tasks which cause for cognition, discretion, inference drawing, even these task elements or task groups now are being gradually delegated to the artificial intelligence and the different modalities through which they can be exercised by harnessing the potential of AI. It's a good beginning, but there's a lot to do and a long way to go because I don't know, perhaps as on date, SGPGIMS is using AI in any way so far as nursing delivery or nursing healthcare is concerned. But a beginning has been made. I would request the organizers to delve upon it, to bring on these stakeholders from within the nursing fraternity, if any, who are using AI tools in any way in providing nursing care. I can give you a couple of examples, like uh, using softwares to raise drug interactions or ADR alerts. It's being done in the country by Apollo. And there must be many more. So if you really want to come out of something tangible, something meaningful, which can be replicated or improved over here at SGPGIMS, then first you need to dig out as to who all from a nursing fraternity are actually using AI tool in day-to-day nursing care delivery. So far as clinical nursing is concerned, and if at all in any domain, the nursing administration is concerned. So there are two verticals within nursing cadre. And you form a cohesive group of those people from all across the country and then work upon it for say, a couple of months so as to draw out a roadmap as to what all we can do as on date, what all can be done subsequently, and come out with a white paper and submit it to the appropriate body, including SGPGMS, so that we can think upon it and we can see how we can integrate AI to improve our patient outcomes, patient safety parameters. Recently, Government of India has also taken initiative to make the patient safety domain as a national program. Yesterday only, the information has come to me, and AI can be factored in nursing care delivery to improve patient safety while it's being delivered in the different patient care areas. I appreciate the initiative, but it would be meaningful only when it leads to some tangible output, which is doable, apt, resource appropriate, and then we can take the lead. Thank you all. Thank you very much.
Thank you, Professor Rajesh Harshvardhan, sir. Sir, as I told you before, sir was always a pillar of us and a guiding path in the last 1 decade. And because of the effort and views sir shared, we have come up in a long way. in improving the nursing services in our hospital. Now, it's my pleasure to welcome Professor Dr. Devendra Gupta, sir, our head Chief Medical Superintendent, SGPGIMS, to have a good word about sir. Sir is the one of the very rarest person who manage COVID in a wonderful, meaningful manner in our Apex Trauma Center, which was Rajdhani COVID Hospital by that time. Exemplary services has made him to receive multiple accolades, and he's always been a guiding force for us. Thank you, sir. Thank you so much for joining, and I request you to please give chief guest speech.
Okay, good morning, everyone. First, it is my pleasure to be part of this webinar, and thank you, our nursing staffs, to invite me. Actually, I don't call nurses. I call brother and my sisters. So I always, in my day-to-day practice, I call them as a sisters and call them as a brothers, not as a nurse. So, and I thanks all my sisters and brothers for the hard work they have provided in the patient's care and making our institute to such a height. Yesterday it was not so, but today in the morning, I just want to share that we are all watching the news from last 3 to 4 days, and we can say that this is a very sensitive time for all of us. We know about what is going on around the borders, our borders. So Government of India has made an alert to all healthcare provider, because we have got a big role when there is any mass disasters. So this is applied to our institute also, and we should be on very high alert. Okay, and we should prepare ourselves in the sense that any can happen in around us, and we may be the persons who can help the people who are in the disasters. Okay. The theme of artificial intelligence. What is artificial intelligence? Artificial intelligence is nothing but making the computer attached with the machines, what we as a common people know, but it is making the machine learning and then allow him to decide this decision makings. In simple language, this AI is a very, very, very smart our juniors. Like what we do whenever any juniors come to us, we teach him that in this situation you do like this, in this situation you do like this, and we try to make him learn, and then we make him independent. That is, in all these situations you have to, I have given all the information to you, and I will give you the power to decide what to do at the time of this particular conditions, and making them independent. So this is just like AI is just like a very smart juniors. So we make them learn, we make the machine learn, and then we give him hand to for decision making also. I'm an intensivist. So at this moment, there is a big role of AI nowadays in the critical care. So if you see that in critical care, when the patients lie on the bed, sister will attach the monitor, our sister will attach the infusion pumps based upon infusion, blood pressures and vitals. This just increase or decrease the drug dosing or infusion pump settings and all. So what the AI based critical care does? What the bed weight, the patient's weight is attached, is shown in the bed. It will calculate automatically. There is a multiple, the parameters are coming in the monitors. It will detect automatically what is the blood pressures, and there's attached infusion pumps. And then we give AI power to decide when to start, what dose to start, what drug to be start, and everything is set. So this is the way now critical care is developing. The mode of ventilation, what at this point when the patient is spontaneous breathing, when the patient is completely paralyzed. So everything are giving to the AI to decide. But overall, the nurse and sister who is sitting on the bedside of the patients, she or he has to console the patients, he and she has to care the patients, not the AI. You people have to handle the patients. You have to, the AI will not calm the patients. Even a simple word of saying to the patients that you will be all right. With this treatment, you will be all right. Many times that is more than sufficient. It is sometimes it is more than sufficient giving the sedation, right? Many times we don't give the sedation. Sister said, okay, just calm down. I'm here. She hold the hand of the patient who is on ventilator, and gradually the patient comes. This cannot be done by the AI. We can, yes, but overall, we should learn about the AI, how the best possible way we can take the help of the AI. We can use that AI for safety of the patients. Okay. The many safety features are there, as I told you, that the setting and all, they can guide you, they can alarm you a bit earlier than the critical events, and all many things are there. So I'm not saying that you should not learn it. I said that you should learn it. You should also learn it how best way we can use the AI in our day-to-day practice. But number one thing is, there's no alternative of your care, your love to the patients, and your handling of the patients than any of the AI. So just keep your dedications to the patients, love to the patients, the good handling of the patients, and use AI as a helping tool, not as an alternative for your or services. Thank you so much, and all the best for today's webinar.
Thank you, sir. You have remind our, lamp light, I would say, for the previous all these months which you have associated with us. And we expect that you will remain more like from a lamp to a sun, so that we will, conquer the skies in the coming days. I'm so sure, I'm so happy that you will guide us into multiple more webinars, seminars, and quality improvement in nursing care in SGPGIMS. Thank you so much, sir. Now I welcome Mrs. Grishma. She is our senior nursing officer, for vote of thanks, please.
A very good morning to each and everyone present here. As we all know, according to Malcolm X, education is a passport to the future, for tomorrow belongs only to the people who prepare for it today. I take immense pleasure in thanking each and everyone who has taken out time to organize this webinar, international webinar of 2025. As it said, the most beautiful thing about learning is that no one can take it away from you, and the more you impart, the more you gain. So first of all, even though in the absence, I would like to sincerely thank Dr. R.K. Dhiman sir, Director of SGPGIMS, and Dr. Shalin Kumar sir, Dean of SGPGIMS, whose constant guidance has always been a boon for us. Next, as it said, feeling gratitude and not expressing it is like wrapping a present and not giving it away. So I would express my sincere gratitude to the strong roots of our SGPGIMS, our CMS sir, Dr. Devendra Gupta sir. Thank you, sir, for enlightening us with your valuable words, because as we all know, we can just learn from AI, but we, the nurses, are the strongest part to provide emotional and care and support to the patients. Thank you so much, sir. Next, I would express my gratitude towards a very beloved and cheerful personality, Dr. R. Harshvardhan, sir, Deputy Medical Superintendent of SGPGIMS. Thank you, sir, for taking your valuable time and coming with us to share your thoughts. I thank Dr. Prashant Agarwal, sir, Medical Superintendent of SGPGIMS. Last time also we heard his words during the scientific section. Thank you so much, sir, for enlightening us always and providing new light to the path we come from. Next, as it said by Mahatma Gandhi, heights attained by great men, reached and kept, were not attained in a sudden flight. They, while their companions slept, were toiling upwards in the night. I take this opportunity to thank the co-organizing secretary of today's international webinar, that is Mr. Dikhil CD. He's taken immense time and pain to go through this. As it said, there is no gain without pain. So his constant efforts have become a great boon for us that we have got this opportunity to attend this knowledgeable session. May we all receive this, gain this through the sessions that is going to come and be fruitful in the coming years ahead. I would express my gratitude to the Chief Nursing Officer, Mrs. Manorama ma'am, whose guidance was there always with us. I express my gratitude towards all the nursing superintendent ma'ams and deputy nursing superintendent ma'ams, whose guidance and constant efforts were always there with us to enlighten our ways. Thank you so much to all those who are coming here to attend today's program and are joining with us through Zoom. May this program be helpful to you and help us to cultivate more than we sow, and may we be fruitful 100-fold times in the years coming. Thank you so much, sir.
With this, we completed our inaugural session. Sir, with your permission, we will move on to scientific sessions.
Please.
Thank you. Thank you. We will start the scientific session within 2 minutes. We will have a short 2 minutes break and then we will start.
We are going to start with the international webinar of SGPGIMS 2025. The theme of today's webinar is Artificial Intelligence in Nursing. So to enlighten you with the words, we start with the introduction to the artificial intelligence, the basics in it. For this, first of all, I would like to invite the moderator of today's session, Mr. Dikhil CD, ICN and Senior Nursing Officer in SGPGIMS, Lucknow. For this session, I will wholeheartedly invite Dr. Vijay VR, Nursing Superintendent and Associate Professor of College of Nursing, AIMS, Raebareli, UP. I will invite you, sir, to enlighten us with your words on the specific topic.
Welcome, everyone. Once again, we are blessed to have Dr. Vijay VR, who is a nursing superintendent, who is looking after one of the most premier institute in Uttar Pradesh and in India also, of course. And he is also associate professor in College of Nursing. Apart from that, it would be, like, I have to say this. He is being organizing multiple programs for the entire nursing fraternity for a quite a long period of time. And I know him for the last 10 years, such a great man, such a dedicated and selfless man who has done so much for the nursing. We are so happy to have you, sir, and all the best. Thank you so much for joining.
Hello, am I audible?
Yes, sir. Yes. You're audible.
Good morning to all of you, and thank you for the kind introduction. Though I'm still not very sure the introduction, the words you said about me is true, or still I have a doubt on that. But still, I'll be trying to meet that expectation. So I would like to express my sincere thanks to all the organizing team, especially Mr. Dikhil, for giving me this opportunity. So can I share my slide from here? Yeah, let me show.
आप वो वन पे आधा वन पे करिए आधे पे आधे पे ठीक है लेकिन 200 ऊपर
My slides are visible?
Yes, sir. Yes.
Yeah.
Slides are visible.
So the topic assigned to me today is Introduction to Artificial Intelligence. So over the next 20-25 minutes, I'll be talking this. I'll be introducing artificial intelligence based on its definition, evolution of AI, the concept of machine learning, deep learning, and generative AI. Can request the organizing team to mute others so that it may not be disturbing for all of us. Yeah, thank you. And the uses and benefits of this AI, and risk and challenges, and future of AI. So I'll be trying to cover, or I will be trying to introduce the AI in these headings. Yes. So I just would like to start my presentation with a small question. Are we using AI on daily basis? Are we using artificial intelligence on daily basis? Yes, of course, we are using it directly or indirectly or knowingly or unknowingly. So whatever gadgets we are using daily in each and every minutes, that has some components of AI, whether it is the Google Map or in the form of social medias or the Chat GPT or any other chat bot like Copilot, Gemini, all those things. So all these softwares and applications are using some more, or at least one or more components of AI. So the answer is yes, we are using AI directly or indirectly in our day-to-day activities. So now the question, so what is AI? So all of us talk about AI. So when we are hearing multiple times about AI in terms of everything. So if I think about social medias, if I talk about the OTT platforms or in the healthcare sectors, so everywhere this term AI is now, it's become very, very common. So what is AI exactly is? So it's a technology that enables computers and machines to simulate human learning. So the term simulate is very, very important, which help to comprehend or for the problem solving or for decision making or creativity and autonomy. In simple words, in other words, I would define artificial intelligence as the science of making machines that can think like humans. So a machine we will be giving data, and this particular machine has the ability to think just like a human brain can do. That is the simplest definition of AI. For example, so suppose if you're traveling to your workplace, suppose from your house, you're traveling to SGPGI by the help of a Google map. The Google map will identify multiple ways to reach SGPJ, and it will give you the best out of these options by considering the distance from your house to SGPJ, by considering the traffic that may occur during in that pathways. So by considering all these options, this particular AI-based Google map will give the best suggestions so that we can reach your destination in time. So there is a simple example that we use on daily basis. Another example is AI chatbot based on generative pre-trained transformer. So when I said generative pre-trained transformer, you may think what it is. It is nothing but it is ChatGPT. So the full name of ChatGPT is AI chatbot based on generative pre-trained transformer, that is GPT. So we are using Google Maps, we are using ChatGPT and many other softwares which are basically AI based. So I'm not discussing in detail about the AI. I'll be trying to introduce the topic of AI on from a common man perspective. In a most simplest way, I will try to make you understand what is AI. And I believe that the subsequent speakers will detailing much more about this different aspects of AI. So I talk about the evolution of AI. So maybe we might have heard about this AI, maybe in recent times, maybe in the last 5 years or maximum up to 10 years. But in fact, the concept of AI has emerged in the 1950s itself. It's about 75 years the concept of AI has emerged in the US. So what is in 1950s? So the first time when the concept of artificial intelligence came, the concept was just like that human intelligence exhibited by machines. The question was, can we make machines which can act as a human beings? From that concept, the entire evolution of AI transformed from this AI to now we are in the place of generative AI. So from artificial intelligence in 1980s, they have developed machine learning. Then in 2010s, the concept of deep learning has come, and now it's a time of generative AI. So this is the evolution, this is the journey of AI from 1950s to the till this particular present day. In the 75 years, the concept of AI has emerged and evolved in a transformative way. So we'll see what all these aspects in detail. So in 1956, John McCarthy introduced or coined the term artificial intelligence in US. So remember, we just started to hear about artificial intelligence, but this particular term of artificial intelligence has coined in 1956 itself, around 70 years before. So the first component of machine learning. So what is this machine learning? So all of us will be quite familiar about this picture. That is Netflix. Suppose if you open this OTT platform and you will be watching some series, some movies, some videos. So all these data will be grabbed by the AI or the machine learning aspect, which is present in this particular software, and they will try to study this particular viewer. So they will understand your behavior, and it will try to give you the series, the films that you like. So after learning you and absorbing data from your search patterns, it will provide you the most appropriate content that you like to watch every day. So this is the small concept, or it is an example for machine learning. So what is machine learning? So machine learning is a subset of artificial intelligence. So machine learning is not just different from AI. So machine learning is a part of artificial intelligence that allows computers to learn from data and make decision or predictions without being explicitly programmed. As I said, give the example Netflix, which recommending shows based on what you have watched before. So this particular machine learning is working based on the data that you are providing, or it will automatically grab data from your search patterns, from your search histories, That's why suppose today you are searching, suppose you want to buy a mobile from shopping platforms like Flipkart or Amazon, and you're searching for mobiles, maybe Samsung, iPhone, whatever. So based on your history of searching, the very next day, it will start to give you more and more option. How? By using this machine learning. So this is the simplest meaning of, or simplest example that you can understand about machine learning. So from the data, so this machine will try to give the output. So now what are the types of machine learning? So we have supervised learning, we have unsupervised learning, and we have reinforcement learning. So now what is supervised learning? So supervised learning means we will be giving data voluntarily to the particular software. For example, so if you want to delete or if you want to block any spam in your mail or in your SMS messages, so you want to block any particular message or any spam mails, then you will be selecting that as a spam. So based on that given data, this machine or this machine learning will try to prevent all the messages which comes from that particular number by identifying it as a spam. That is an example for supervised learning. So whereas for unsupervised learning, it finds patterns in unlabeled data. For example, customer segmentation. So you may not be giving data from your search history, from your pattern or from your search history. This machine will automatically identify and it will start to give you the outputs as you wish. So what is this reinforcement learning? So reinforcement learning means learns by trial and error through rewards. So rewards in the sense, suppose if you're searching, if you're watching something in YouTube, and some advertisement will comes, and those in which you are not interested, you'll be skipping it, right? You'll be use the option skip the ad. So it will be automatically it will try to stop such advertisement by understanding that you are not interested. So this machine will adopt a pattern of trial and error. It will give you some of the options, and how you are reacting to that particular option, this machine will give subsequent options for that. So these are different types of machine learning. And this is one of the major component or major subset of artificial intelligence. Now, what is deep learning? You might have heard about this term, deep learning. So this is just like a specialized branch of machine learning. It's a part of, or it is a specialized form of machine learning that uses neural networks with many layers. So it means this deep learning will be using a neural network pathway, just like how our brain behave or how our brain identify the things and how our brain is interpreting a particular stimulus. Similarly, if we give a mass data, so we have to give a complex data like images or speeches or anything. So this machine will try to work just like a brain. That's what is called as deep learning. It is just like the basic concept of this deep learning is how a brain works in a normal person's behavior. Similarly, this machine will work based on the big data. So for to work this deep learning aspects, it requires a deep data or mass data. So you might have heard about mass data, right? So the all these software companies, for example, Flipkart, Amazon, all these things, they are using these mass data. Based on this mass data, it will try to study the different aspect of a customer, and they will be providing data accordingly. For example, the Siri, we are using this MacBook, the Siri software or Google Assistant. So they are basically using deep learning machines. So now we are in the era of generative AI, generative artificial intelligence. So whatever we have seen so far, like whether it is machine learning or if it is in the deep learning, so these two things will act based on the data that you are giving. If you're giving minimum data, for that machine learning is enough. If you want to solve a complex data or mass data, it use deep learning facilities. Now, what is this generative AI? So generative AI means so whatever data it has already, this particular software try to create a new or original content. For example, text. It can generate a new text. It can generate an image. It can generate a music or even videos. That's what commonly we use ChatGPT. Suppose if you're writing, please prepare a email or please prepare a request letter. So this ChatGPT will automatically generate a mail content or any request, any application, everything. So it can generate by its own. It can generate text, it can generate videos, it can generate music, chords, everything it can generate. Even the images, you might have seen deep fake images, right? So all these things can be generated based on the data it has already. So it is not just copy of any other things. It is this machine is automatically generating, which is not existing now, which is something new, and it's not just copy paste. So it can generate text, it can generate images, it can generate music, or it can generate any codes that we commonly use in ChatGPT. So ChatGPT or the Gemini or Copilot. So these are some of the commonly used generative AIs. ChatGPT is OpenAI, and Copilot is by the Microsoft, or Gemini is by Google platform that all of us will be commonly using. So what is the impact of artificial intelligence in the society? Yes, so it will help us in our workplace to transform our workplace. It will help us, or in our personal life. So these softwares, these artificial intelligence will make our job very easier, very smarter. Yes, we always believe in hard work, right? But this artificial intelligence help our life to make it more smarter. So we are now living in the era of smartness, not just like hard work. So hard work is important. With that, the smart work is important. So here, the role of AI comes, which makes our life and job more smarter than previous. So there are numerous benefits and uses of artificial intelligence. So in each and every aspects, it can be used. For example, in healthcare, all of us, I believe the subsequent speakers will detail more about its benefits in healthcare. So in healthcare, commonly it can be used for detecting a particular disease based on the data, or it can predict the onset of a particular disease, or it can be used to give personalized medicine by understanding the nature and characteristics of a particular person, or even by using AI, the robotic surgeries. Now, you might be heard about this robotic surgeries. So artificial intelligence is using for this performing robotic surgeries. This AI can be used for finance, for education, for daily life that we are using for Netflix, for Google Assistant, Siri, Gemini, everything we are using this. So there's numerous areas where we can use, where in the form of automobiles for generating, because it is error though. So when the humans are preparing a machine, there is a chance of errors, right? But when AI is used, the chance of errors are very, very minimum. It can be used in the automobiles, it can be used in the manufacturing with the precision. So precision is another key aspect of AI. So without errors, with most accuracy, with most precision, a particular thing can be manufactured. So it can then gaming, it can be used in government. So in on daily basis we are using for an AI based cameras, artificial intelligence based cameras in the weapons, in the new war is happening nowadays. So everywhere this AI based aspect is using. In the healthcare it can be used, the finance, education, business, everywhere. So what in whatever areas we are involved, so everywhere this AI can be used. So now, so do you think that there is some risk of AI? Yes, there are numerous benefits, but with that, there are some risks as well. For example, job displacement. So nowadays, the IT companies, you might be heard about this IT companies. They are the many persons, many software engineers, they are working in IT field. They are losing job. Why? Because rather than a human being, this machine can perform the work at quite faster and with more precision. So the requirement of human beings are less. So it can lead to job displacement. So the reskilling or upskilling of human capacity is very, very important. So to prevent job displacement, so there we are learning more and more skills. Now it's about everything is about skill. So we need to reskill. So the new term is coming up is upskilling or reskilling. So as a human being, we have to compete with this AI for stabilizing our job. Then there can be bias. Why there is bias? Because so the output which is generated from the AI, it is typically based on the data that we will be giving. So if the data that we are giving is manipulated, then the output will also be the same. So when we give the data, it must be correct, it must be accurate, so that we can expect much precise work of output from that. Then third is privacy. Yes, of course, privacy matters. So everywhere there is AI-based cameras or the social medias, everywhere there is privacy breaches happening, and that we are hearing every day in the social medias, or deep fake images and deep fake videos are creating by the so many persons, those who are anti-social activities are doing, or they are creating by using this artificial or generative AI. So there is a probability of breaching the privacy of individuals or a community or a country even. So there is a matter of privacy breach that we are hearing and seeing the newspapers and in the media every day. And deep fakes. So what are the deep fakes? So we can create a generative images which may look similar to a particular person's. So you might have recently there were many videos, many images that has been created by using these artificial intelligence. It is called as deep fake videos and deep fake images. So it is very much difficult to differentiate from the original images with this particular deep fake made images. Then persuasive AI. What is this persuasive AI? So it's saying that the artificial intelligence can influence the attitude and behaviors of human behavior. Because nowadays we are depending blindly on AI softwares. We are depending on ChatGPT. We are depending on search engines. So everything we are depending on. So all these activities, we are blindly started to believe in artificial intelligence. So the behavior and attitude of human can be changed. So this AI can decide, or it can influence the human behavior and attitude of human beings. So it's one of the risks. Then weaponization, yes, of course, that's what we are seeing in the last couple of days. So the artificial intelligence are being used for drones. The last 2 days we are talking about drone attack. So this drone attack is, again, it is drones are working based on this artificial intelligence. These deep learnings and machine learnings are using for the functioning of these drones. So this AI can be used as a weapon against another countries. So it is another risk. And ethical. So here comes the aspect of ethical aspect, whether the use of AI is ethical or not. Yes, if it is depends on the response, it is called as responsible AI. So if a person is using AI with some responsibility, this is well and good. But if it is not using, or if it is unethically using for some negative works, it is unethical, of course. So certain policies, certain regulations need to be taken from the administrators, from the government level to control or to maintain the ethicality of artificial intelligence. Next, it's power seeking. So now it's saying that those who are having this AI, they are strong, right? So US, they developed ChatGPT, and recently China also started to develop other open AI based, chat box. So now it's the presence of how they are strong in artificial intelligence that decides the power of a country. So some countries are good. For example, the technology is China or Israel. They are highly advanced in terms of artificial intelligence and generative AI. So all these are some of the risks that we are facing because of artificial intelligence. So what is the future of artificial intelligence? Yes, this artificial intelligence is expected to continue transforming industries and daily life. Yes, it is influencing our daily life on day-to-day basis, or the industries, everything. Everything is decided by this AI. So what we require is more human-like AI through advancement in general intelligence. So some humanistic approach need to be given this particular AI. So ethical and responsible AI development to mitigate the risk. So whatever risk we have seen in the previous slide, that need to be mitigated by using ethical and responsible aspect. That two components need to be added with the existing AI to make it more beneficial. So ethical need to be added. So ethical responsibility, we need to incorporate it within the existing AI. And this particular AI can be integrated in areas like mental health. So mental health, now all of us are much merged with all these advancement, and the mental stability is disturbing. So this AI can be even used, or it can be integrated with your existing mental health, and it can be used for climate change solutions, or it can be even in the form of robotics. So in many areas, So AI can be incorporated, and the future of AI is bright, and that degree of brightness depends on how we are utilizing it. Are we using ethically? Yes, it will be bright. Are we using responsibly by considering the responsibility? Yes, again, it will be brighter. But if we're using unethically, irresponsibly, then the future of AI will be dark. So, and you might be heard about this Tesla cars. They are self-driving cars. So, in each and every areas, AI is already started to integrate. And definitely, the future of AI will be bright by considering. At the same time, we should keep in mind that it should be ethically sound and it should be responsibly. We have to use the AI. So by concluding, so it requires collaboration between technologists, policymakers, and the public to create a future where AI enhances the human experiences, promoting innovations and convenience without compromising individual rights or ethical standards. So when we forecast the future of AI as brightening one, the same time we should not compromise individual rights and ethical standards. These two things we should always keep in our mind when we think about artificial intelligence. Thank you. That's all from my side. So I believe I have tried to introduce the concept of artificial intelligence and its sub themes or sub aspects in the most simplest manner by quoting some of the daily using AI-based softwares. And thank you once again to the organizing team for giving me this opportunity.
Thank you, Dr. Vijay. This is the reason I just said in the beginning itself that you are the most appropriate person to grind and make the juice out of the most complex topic, so that everybody will understand about each minute aspect of this complex technological thing. We are so grateful to you.
Thank you.
The mind is
Thank you once again.
fire to be kindled. Thank you so much, Vijay VR sir, for kindling our minds with the basic of artificial intelligence. Your slides and the way of teaching has enabled us to understand better. Thank you so much, sir. Next, we are privileged to have a valuable international speaker to throw light on the topic artificial intelligence in healthcare. Dr. Karen Webb, PhD RN, is an assistant nursing professor of nursing at North Carolina Central University. Her research focuses on reducing
So 5 hours need to attend. They attend the regular classes. ఇంకా
community-based preventive intervention targeting chronic diseases. She integrates nursing, public health, and behavioral science to develop strategies that promote health behavior change in vulnerable population using mixed method research. Dr. Webb is a co-principal investigator of a $1.5 million NIH-funded project, BFAP HBCU, which aims to improve health literacy and physical activity among students through an M-Health intervention. She also collaborates on interdisciplinary research with faculty across health and social science disciplines. With a background in cardiac and critical care, Dr. Webb brings real-world experience to the classroom. She is committed to inclusive, student-centered teaching and actively mentors students in both traditional and accelerated nursing programs. Most recently, she has been tasked with leading initiatives that explore the integration of artificial intelligence into nursing education and research to enhance academic engagement and evidence-based decision making. We wholeheartedly welcome you, ma'am.
Thank you so much. Can you give me 1 second, please?
మనిషి మాత్రం లేదు ఇక్కడ నాకు
Thank you so much, everyone, for your patience. Dr. Sujaya is actually going to help me with my screen, if you don't mind. I'm going to stop share and Dr. Sujaya, tell me when you're ready.
Yes, madam, we will be sharing your screen from our end.
Oh, you will?
Yeah, yes.
Okay, that sounds great. Please do it. Thank you.
PPT है हाँ वो फोल्डर में first.
There you go. Thank you so much. Good morning, everyone.
Good morning.
Good morning.
Thank you.
It's about 1:30 a.m. our time. And we're Dr. Sujaya and I are so thrilled to be here. I really want to give my appreciation for being able to join you all today in this session because it is such an important topic. The AI in healthcare and AI in education. I just want to tell you a little bit about how I got here because it definitely was not my background a couple years ago. You know, my own journey began when I was asked to join the North Carolina Central University AI task force. And I joined with multiple disciplines and we did a lot of work with Duke and UNC Chapel Hill to figure this all out. And so I was really working along with many different interesting individuals, exploring how this emerging technology could be integrated into our curriculum, which Dr. Sujaya will talk about, and healthcare systems as well. And it really opened my eyes to both the promise and the challenges of AI. And we began to ask deeper questions, which led us to explore where AI in healthcare really began, because it seems so new to us, or really was it? And why has the idea seemed to have just emerged in the past couple of years? And most importantly, we had to figure out where it's taking us. So that curiosity really led me here today to explore all of those questions with you. I'm looking forward to hear all of the speakers here today and to share some of what I have learned. As mentioned earlier, it's really important for us in the university to stay informed of what's happening in the healthcare systems as well. And I do want to add that I still work in the hospital system and in rural care. I do hospice as well. We need to do this because we need to align our curriculum with current practice. So going to the timeline, I just want to start with some historical context, and you've already got some of this anyway, but AI in healthcare really began as early in the 1970s. And although nursing really wasn't involved in it, we had systems like MISIN, which was that artificial intelligent expert system that was developed at Stanford University, and it was really to help identify bacteria causing severe infections, and then it would recommend appropriate antibiotics. And then you go to the late 1990s, where nursing specific applications began to emerge. And I've been practicing long enough where I can remember some of this, because some of us nurses, at least in the United States, we kind of were, putting our heels to the ground. We liked our old way of doing things. So it was really hard for us to really embrace some of these tools that were being being introduced to us, including the way that we started to document. So we liked our old paper, and all of a sudden we had electronic health records, and we were documenting on digital formats. And all of this really started to allow early AI systems to process patterns in nursing notes and care plans. And nursing informatics began to take root as recognized as a specialty, laying really the groundwork for today's AI-driven decision support tools. And then, of course, in the 2000, we were all supposed to be on electronic health records and clinical decision support systems. And as we see in the 2010s, we start seeing more advanced tools that could predict outcomes in healthcare and nursing. What was nice about this is because some of these advanced tools could read and extract key information from our clinical notes and our nursing documentation, and even our discharge summaries that would flag warning signs in healthcare. So things like, if a nurse would say something like patient feeling dizzy or weak, that might trigger a fall risk alert. It could also summarize records or create clinical reports automatically. So again, we've been using it, but for some reason, it just feels so new to so many of us. And then, of course, in the 2020s, we're seeing a significant leap forward. Tools like Nuance Docs, which allows real-time voice to text transcription during patient encounters. I'm using this personally in hospice. So I go out to rural communities and I see people in their homes. I use real-time voice when I'm transcribing my encounters with my patients. It's reduced my charting time. It's also supposed to improve documentation accuracy. I will say that I do have to go back and check everything because it doesn't pick up everything I say accurately. We have predictive staffing models that use AI to forecast patient acuity and volume trends, and this helps your nurse managers optimize staffing levels, and it's supposed to also help reduce nurse burnout. We have a huge nurse burnout problem in the United States. I'm not sure how it's like there, but we do have it here, so we have to figure out ways to reduce that. And again, in home health, we have AI-enabled devices and platforms that monitor patients' vitals remotely. We can flag trends before issues escalate. And there are also increasing emphasis on ethics, bias, and equity in the development of the use of AI tools. And this simply means that hospitals are now evaluating algorithms for fairness across race and gender and socioeconomic status. And this is really notable in major institutions here in North Carolina, like Duke University and UNC Chapel Hill. They have launched quite a few AI initiatives that are really driven by nurses today. Next slide, please. So again, why does AI feel so new in healthcare? I don't know about you, but it certainly does for us. And it's because technology has finally caught up. And I think with ChatGPT and people are using it more, it's kind of at the forefront for us all. So again, for years, AI was more an idea than an application. But now we have this computing power, we have these cloud platform and massive data to actually make these tools work accurately and in real time. We'll also say mainstream visibility has exploded. So again, thanks to ChatGPT and similar tools, AI is no longer something that's hidden behind the scenes. It's accessible. We're using it personally, and healthcare professionals really are realizing that they're interacting with AI, even if they don't call it that. We also have healthcare pressures and demand innovation because of staffing shortages here in the US. We have a problem with staffing shortages, particularly with nursing. Part of that is due to burnout, like I was talking about a minute ago. And also budget constraints are forcing systems to find new ways to deliver safe and efficient care. And so AI isn't a luxury, it's really becoming more of a necessity to support overwhelmed teams. Ethical concerns and health equity, with that growth comes responsibility. We've really seen how unchecked technology can worsen disparities. So nurses really are key to making sure that AI tools are fair, ethical, and patient-centered. So nurses are now at the table, and historically AI tools were created without input from nurses. And the people, it's important to realize that, because nurses are the people who spend the most time with the patient. So today, nurses are contributing to the algorithm design. We're contributing to policy reviews, and we're also contributing in AI implementation and practice. So we're not just reacting to AI anymore, we're shaping what it looks like in care delivery. Next slide, please. Thank you. I want to really point out and emphasize for you all why nurses must be at the table. So nurses are the largest healthcare workforce. Here in the United States, we have nearly 4 million nurses. They provide continuous frontline care more than any other provider. So decisions made by AI tools directly affect nursing workflow. It affects our workload, and it also affects how we interact with our patients. So nurses today, we know that nurses know the whole patients. We see more than clinical systems. We understand their social, we understand their emotional and environmental factors that influence their health. So insights from nurses are crucial to design AI that supports holistic patient-centered care. I also want to add that nursing judgment is not replaceable. AI may suggest actions, but nurses use context, we use compassion, and we still use critical thinking to make the final call. So without nurse input, AI tools may oversimplify or even miss nuances in real world patient care. So we have to be careful with that. To prevent bias and promote equity, so we have algorithms that often reflect the bias of the data and developers. So nurses really, especially from diverse backgrounds, help to ensure tools are equitable, ethical, and inclusive. So we we really play a pivotal role in that. Next slide, please. What's really awesome, I think, is how AI is changing nursing roles. So we already see that AI is shifting the landscape of nursing, both in practice and in professional development. Traditional nursing roles are evolving to include greater interaction with data, to include greater interaction with technology and interdisciplinary teams. So that we see here new titles are emerging as nurses engage in AI tools and as nurses shape policies and as we lead innovation. So some examples of new and evolving roles include the nursing informatists. So they integrate data, information, and knowledge to support clinical decision-making. And again, as alluded earlier with other speakers, this is all about improving patient outcome. Clinical AI specialists we have now that works at the intersection of AI systems and clinical operations. And these nurses help to evaluate and also implement and monitor AI tools in patient care. And then AI ethics advisors in healthcare, which is so important to ensure that ethical use of AI by evaluating tools for, again, fairness, transparency. And then you have algorithm review board members as well. So they participate in hospital committees that approve and oversee the use of these clinical algorithms. And again, all of these roles reflect a broader shift towards data-informed technology, which is really going to shape leadership in nursing. Again, nurses are now key contributors to innovation. We are not just simply users of technology, but we are now co-designers and guardians of patient-centered AI applications. And next, we can see some real tangible AI tools. And so next slide, please. And that are already being used in practice. And these are, again, aren't theoretical. They're happening right now across healthcare systems in the US and globally. We have Nuance Docs, which is that voice to text that transcribes conversations into real-time electronic records, health records. It's being used here at UNC Health and other systems, and it It's the importance of it is supposed to reduce documentation times. So nurses can focus more on patient care rather than always being at the keyboard and not looking at your patients. We have sepsis prediction algorithms that are built into platforms like we use Epic. Again, all these tools alert nurses to early signs of things like sepsis based on real-time vital signs and lab data. This is important because, again, they've been used for a while because they support faster and life-saving interventions. And we have wound assessment apps, and this is really, these are nice because they are used in a lot of rural settings or long-term settings to analyze wound photos and track healing and help us decide on care plans in regards to different types of wounds. I use them in hospice. In hospice, we have patients that have lots of wounds. And in the past, we used to have to take digital pictures and figure things out ourselves. And now apps such as Swift Medical are helping us guide these clinical decisions much more quickly. We have fall risk predictive tools that are integrated in these clinical decision systems that flag high-risk patients, and we have virtual nursing assistants that provide education and triage support to patients after discharge. And then, of course, remote monitoring, we're using that quite a bit, especially with Mayo Clinic and Kaiser to support at-home care. And so again, and lastly, I do want to also say for staffing, we have AI staffing tools like Chronos that predict analytics to help managers schedule more effectively. So all of these tools really enhance decision-making in healthcare. They help to reduce risk and support nurses in delivering high quality and efficient proactive care, I might add at that. Next, please. What I do want to say is that AI is not replacing nurses, and I always have to share that with my students. Nurses who use AI may replace those who don't. So that's really important concept. And this isn't really meant to scare anyone. It's meant to challenge all of us nurses to make sure that we stay current. We should not see AI as a threat. It's a tool, just like your stethoscope. It's something that nurses must learn to use well. Next, use a nursing perspective to shape the future of healthcare technology. Nurses should not only use technology, we must help design it. AI doesn't reduce our humanity. It should give us more time to express it. I'm still on the previous slide. I'm sorry about that. So AI doesn't reduce our humanity. Think about this: if AI can reduce charting time or alert us sooner to changes, we can spend more time doing what we can do, comforting patients, educating, and then advocating for our patients, and also connecting patients with family. Bringing a vision. Imagine this: a shift nurse, where a nurse asks their AI assistant what changed most in the last 12 hours and get a smart, synthesized, risk prioritized answer. That's not science fiction anymore. It's where we're headed, and nurses really must shape how we get there. We've always been at the heart of care. So now we need to be at the forefront of innovation in healthcare too. And then finally, my last slide, I just want to say that again, nurses have always been at the heart of care. As AI transforms in healthcare, it's not replacing us. It's really calling us to help lead this innovation. So whether you're at the bedside or in the classroom or charting next, remember the future of nursing includes technology and an AI, and it just depends on all of us to shape it together. And thank you so much again for inviting me to speak here today, and again to learn from all of you.
Thank you, Dr. Webb, for joining. This is the first time, though we have conducted international webinar for last 4 years. This is the first time we have a American national who came and delivered, the entire knowledge to all the Indian and all other nurses who have joined from across the globe. Thank you so much. It's so wonderful to hear from you, and we look forward to more association with you in the future also.
Thank you so much. I do as well.
According to Mahatma Gandhi, live as if you were to die tomorrow and learn as if you were to live forever. Thank you so much, Dr. Webb, for imparting your valuable knowledge, especially during the wee hours of your place. Thank you so much, ma'am. Hope we all benefit from Dr. Webb's lecture sessions. Thank you, ma'am, for the wonderful session. Hope your support and guidance will always be a part of us. Thank you, ma'am.
Thank you.
We now have with us Dr. Sujay Lakshmi Devarya Samudran. Ma'am is working as an associate professor, tenure track, in the Department of Nursing at North Carolina Central University, Durham, NC, USA. She has over 45 years of experience in teaching. She instructed students from distinct levels and at various locations across the globe. In India, she worked at the College of Nursing, Hyderabad, Kurnool, Andhra Pradesh. She also worked at St. John's College of Nursing, Bengaluru, Karnataka. Worked at Muscat Nursing Institute, Sultanate of Oman. Since 2009, she has been working in the Department of Nursing, NCCU, and teaching various courses for traditional ACL nursing students. She is the recipient of following certificates. Certificate in Effective Instruction, Association of College and University Educators, 2018. Certificate in Effective College Instruction, Micro-Credential in Promoting Engaged and Active Online, March 2021. Advanced Certificates in Effective College Instruction, 2021 from the Association of College Educators and the American Council on Education. Advanced Certificate in the Effective Teaching Practice Framework, Certificate Inclusive Teaching for Equitable Learning, and from the Association of College and University Educators and American Council on Education. Keegan Workshop Certificate, Leveraging AI into Develop Course Resources, Mental Health First Aid Instructor, Question, Persuade and Refer Instructor, Guiding Universities in Demonstrating Empathy Instructors. She received the following awards and recognitions. 3 Decades of Caring, Indian American Nurses Association of North Carolina, 2017. Faculty member for Food Lion Feeds NC Campus, Collegiate Hunger Challenge winner of $10,000 in 2018. Outstanding Volunteer Award for Excellence in Service and Leadership in International Education from North Carolina Association of International Educators, March 20, 2020. Selected as a Grade 100 Nurse of North Carolina for 2021. Daisy Award from NANA 2021. Faculty Mentor, NC Collegiate Hunger Challenge, Social Media Winner, $1,000 in 2022. Volunteer Award from North Carolina Association of International Educators in 2023. Contribution to the Women's Empowerment Award from North Carolina Central University 2023. Best Poster Presenter for the first International Conference on Current Environmental Technologies for Sustainable Development, Graphic Era University, Dehradun, India. Ma'am has published and presented in the areas of HIV, AIDS, health literacy, delirium prevention and management, emotional health and resiliency, technology and nursing and care of older adults, COVID-19 self-care management, post-pandemic care model, social entrepreneurship in local, state, national and international conferences. She is a member of various professional and non-profit organizations and has taken up leadership role in national, state, and local level organization. She is very enthusiastic about community service projects such as HIV, AIDS, homelessness, refuge families, women empowerment, elder care, mental health, and hunger prevention projects. She loves to work with students. She enjoys sharing food, culture, resources, and social skill. We are so grateful to have you here, ma'am, along with us.
Thank you so much. Are you able to hear me?
Yes, ma'am. Yes, yes.
I want to thank the Hill for connecting with us. And thank you so much. I want to thank Dr. Karen Webb for presenting. It's, as she said, the time is almost 2 o'clock in the morning. So we are excited. I want you all to do a small exercise so that way, already you heard like two presentations. So let's do a simple exercise, just stretch ourselves. So that way we are awake. So can you all do it, please? Stretch. Okay, and clap. Clap yourselves because you're all here on a long day. So I appreciate each one of you. Clap yourself, hug yourselves. You are doing a wonderful job. I appreciate each one of you. Okay, let's start. My earlier presenters made this activity very simple. So as an instructor, my job is to ask questions now. So in the chart, kindly write 3 things what you learned from earlier presenters. Maybe short. What did you learn as a nurse? Like, what is artificial intelligence? What did you learn? Let us see in the chart. Kindly do that. Then I will start presenting. Do you have the access to do the charting? Like in the chart, can you do that or is it disabled? We want little interaction. Yeah, you can type. Okay. Okay. Let's move on. So what is my goal? Let's identify the key technologies used in nursing care. Analyze the impact of artificial intelligence on patient outcomes, workflow efficiency, and clinical decision making. And the last one, recognize essential skills nurses need to effectively engage with artificial intelligence. Because already we learned what is artificial intelligence, the history of it, how it's developed. It's not new, it's there. But we are putting more emphasis and we have to work on this. And some of us are already there, like Dr. Webb mentioned, they're taking the lead. So let us see what are the types of technology. We learned the importance of it, what is artificial intelligence, the history and all. So my emphasis is, hey, if I want to be proficient in artificial intelligence, what are the technological skills I need? What type of technologies I need? So if you know what to do, then you can do it. So in this picture, you can see the patient is in the bed. This is like a home scenario. So she is getting some education and her data, like you can see the pulse oximeter and blood pressure cuff and other things. So her data is being transferred. In the bottom picture, you can see the nurse and the patient are listening to someone else.
Excuse me, ma'am.
Yeah.
Excuse me, Divya, ma'am.
Yes,
Ma'am, your
Slides are not at share.
slides are not visible.
Not visible. Okay.
Yeah, ma'am.
No.
Okay, I'm sharing it again. Share.
Yes, ma'am. Now it is.
Now it is? Okay.
Now it is.
So,
Slide,
okay.
slide show.
Just we finished our objectives and moving on to the next one.
Madam, can you put it on slideshow
Yeah.
mode, ma'am?
Yeah, that's what I'm trying to do.
Thank you.
Are you able to see it now?
Yes, absolutely fine.
Okay, wonderful. So we are seeing the types of technology. So what I was showing about these two pictures and our earlier speakers, they mentioned about chatbots. And we are using a lot of virtual assistants for the technical assistants, nursing assistants. Even they, a lot of information is done like triage, health education, even to get appointment. Nowadays, when you ask for the appointment, you have to answer all those things, and a lot of work is done by artificial intelligence. And we are seeing the remote monitoring, like computer vision. So they monitor the patients. So by this, we can prevent falls and detect any early risk for elopement. And our earlier speakers mentioned about predictive analysis for the risk assessment, like wound care, if there is any disease detection or wound, how wounds are healing. So all those aspects. That means we need to be ready with the technology. And other aspects, we heard so much about robotics surgery, and robotics are helping us in so many aspects, like mobility support. Even it gives the reminders. And all of us are wearing smart technologies, like wearables, like smart watches, or monitoring, like for the blood sugar wearables, ECG monitoring, blood pressure monitoring, all those aspects. So thereby, sitting at home, we can send our data. Instead of going to the hospitals, we can send all the data and we can work on that. And digital health has really revolutionized our healthcare system, especially with the electronic health records. We have EPICs and other things, and virtual care, mobile health care. Other aspect is natural language processing. As Dr. Webb was telling about, she was getting her, all the data is being documented, text over, like voice over text, messages and all. So in this, you can see the patient is monitored. So this avoids like alarm fatigue and unnecessary disturbance of the patient, so patients can get enough rest and the nurses can focus on other work, more work than routine, check those aspects. It enhances the staff efficiency. So staff can have more time to do the work where high priority care is taken care. And it improves the nurses' workload and reduces the alarm fatigue. So these are the technologies which we have to enhance ourselves. So what is the impact? As earlier speakers mentioned, yes, definitely it improves the patient care for the safety, quality of care, optimization of the workflow, enhances the decision making, and clients will be empowered. They will be more engaged in the work. Other required skills. You may be, in case if you have all these skills, you will be champion in the artificial intelligence application. So technological skills, our earlier speakers mentioned about generative AI, deep learning systems. Like we all need to know there is so much going on with the technology. So we have to keep pace with the technology. And critical thinking, AI is not replacing humans, they are substituting. So our critical thinking, clinical judgments definitely needed for patient care or patient safety. So what we have to do is adapt to the new technologies, continuously improve and learn the technologies. So that means we need to have the growth mindset and open mindset, and balance with the patient-centered care, with the personalized care, compassionate care. So we have to use these technologies. In order to maintain that, one need to be a lifelong learner, stay focused, learn the innovations, and overcome the resistance with the positive attitude and adaptability. So we have to have digital and data literacy and analytical skills. I'm very happy, even in India, we started students started learning about nursing informatics. So in US, we have special, role on digital informatics, nurses informatics. They are in the research field. They are in the multidisciplinary team. They are leading in the activities. So we have to ensure transparency and accountability. And Dr. Webb mentioned about the importance of collaboration, multidisciplinary team. As nurses, we are working with the multidisciplinary team, so we have to work with everybody and maintain those aspects. You may be wondering why I'm using this learning. As nurses, we are lifelong learners. So nursing, my topic is AI in nursing. So nursing will be education, like bedside, research, administration, all angles. In all 4 angles, AI plays a major role. As lifelong learners, there are a lot of benefits. So some of them are, when we go for further education, like maybe master's, PhD, or maybe certifications or any of those things, we should use this AI technology for our enhancement of our learning. So when you are planning, depending on your learning styles, AI will decide like what kind of analytics you can use. Even it gives the content recommendation depending on the type of learner you are. And then chatbots and assistants, virtual assistants helps us. If you are using AI in nursing education, it helps in grading systems, even tutoring. Depending on the individual needs, the intelligent tutoring systems supports a lot. So the tutors are, AI tutors are 24/7 and it is individualized. And curriculum learning planning is needed. So virtual learning that's happening and simulation, virtual learning. As I mentioned, these tutors, AI tutors, the chatbots, they are there for 24/7. So they are really enhancing the learning aspect. They help in personalized learning. And some of the language tools like Duolingo. What I'm seeing like TNA and other organizations are helping nurses to go and work in abroad, like Germany and other places. So if you are traveling to other countries, to be a global nurse, we need to know the language. In order to learn the language, in olden days, we used to sit and learn. Now, this Duolingo helps a lot. You can learn on your own, at your own pace. So before you go to the country, you are well versed with the language. Without language skills, you may be excellent in technical skills. You may not be able to do good patient care and predictive analysis to improve about the performance. So these are all the technical skills what we need to work effectively as a AI. Other career development. AI helps in career advising. Like some of us, like after graduation, like after BSN, you may be wondering like where you want to go, what you want to do, whether you want to go in education field or nursing, nursing education or administration. Where do you want to go? What you want to do? So you get career advising through the AI, and AI helps in developing a resumes. Curriculum, resumes, interview coachings, internship, internship matching with the employers. Some of them are like LinkedIn AI, Career Insights, AI tools that helps in analyzing and suggest for the career paths. So they give us like depending on our views and our needs, our styles. So in summary, AI has the power to revolutionize nursing care. So nurses must leverage compassionate care, ensuring equal access and ethical use.
क्या कुछ ठोक पीट के ठीक कर दिया
Yeah.
I request all the participants to mute yourself, please, so that our respected speaker will not have any hurdle to speak. Please.
So what is the call to action what we are asking? So embrace AI while advocating for the responsible AI in implementation. So this is what our earlier speakers also mentioned. And I also humbly request everybody, embrace AI. So what is the take home message? So in this picture, you're seeing like, grab the opportunity. Don't resist for the challenges. Embrace the challenges and see AI as enhancing the patient care and supporting us. They're not replacing our jobs. They're not hindering. So once we get that acceptance, then we will really embrace and work on that. If you have any questions or comments, kindly let me know. These are my references. And you can put it in the chart. What did you learn from this? Our earlier speakers has mentioned, so it's like a summarization, my aspect. So as nurses, we work in different fields, whether it's education or practice, everywhere we have to use AI. AI is a must. So accept and work on that. Thank you so much for the opportunity. I'm stopping the.
Thank you, Sujaya ma'am. Thanks a lot. That's so blessed to have you, and you have coordinated with the Dr. Webb also to speak for us. So it's so wonderful, and we have Dr. Radha, your friend, here along with us. So, Madam will have a word about you.
Very good morning to all the participants who have joined and make this webinar is successful. Dr. Sujaya ma'am, it was a very wonderful, informative talk on AI, because this is a beginning, and the way long back AI was started, even then the interconnection with the AI, it is a blooming area. So now it is our own, everyone's responsibility to put our mind, whole soul, heart towards towards AI, to grab the chances to inculcate into our field. Thank you so much, ma'am.
According to Nelson Mandela, education is the most powerful weapon to change the world. Thank you so much, ma'am, for sharpening those powerful weapons with your effectual and productive lessons you've taught us. Let us all imply what we have learned, because knowledge without practice is like serving a buffet but are unable to eat. So let us effectively use what we have learned to improve our nursing standards and care. Thank you so much once again, ma'am, for sharing your valuable time and knowledge with us. Next, I would like to invite Indu Yadav, ma'am, Deputy Nursing Superintendent of SGPGIMS, to moderate the next session. She is poised, and her unflappable personality and smiling self always leaves behind a positive aura wherever she goes. We have with us an eloquent speaker, Dr. Radhika CK, to emphasize and illuminate on the topic Machine Learning, Innovations and Research. Dr. Radhika CK is an assistant professor at the Government College of Nursing, Ernakulam, Kerala, PG from MG University, Kottayam, Kerala, and PhD from Kerala University itself. We are highly thankful for coming here, ma'am, and spending your precious time with us to impart your knowledge.
Thank you. Thank you, team Sanjay Gandhi Institute. I've sent the slide. Shall you share it from your end? Yeah, thank you. Good morning, everyone. At the outset itself, let me thank the team Sanjay Gandhi Institute for selecting such a wonderful and such a relevant theme for this Nurses Week Celebrations Academic Feast. And special thanks to Dikhil for connecting me and inviting me to this webinar. I think my esteemed previous speakers have simplified my way ahead, because almost all the topics or all the aspects they have discussed, and it's very easy for you also to understand it much better. And as we said, artificial intelligence actually it is a boom word or buzzword in today's world, where we cannot think of without a world without AI, because that is the importance of AI in our day-to-day world. So today, let us have a few glimpses of what is machine learning in healthcare, or what is the role of machine learning in healthcare. Actually, the previous sessions itself, you might have heard about the term machine learning, and it's actually a subset of the broad term artificial intelligence. Let us see. So in this session, I'm dealing with the introduction, applications of machine learning in healthcare, in the healthcare sector, the challenges, future directions, and summary. Am I audible? Hello?
Yes, madam,
Hello?
you are.
Yeah.
Madam,
Thank
you
you.
are
Thank
audible.
you. Yeah, thank you. Because okay, so within this short period of time, you might have got an idea about the healthcare landscape and what is the role of AI in healthcare sector. Because in each and every with each and every day, newer and newer advancements are coming, and it actually in many ways. Sorry, some disturbances are there.
First one.
Yeah. Okay.
I request all the participants to stay muted, please.
I think Nikhil, that you can mute from your end itself.
We are muting, ma'am.
Yes, we are doing that, but still
Yeah,
somebody is on.
Yeah. Thank you. So that is the role of AI in changing the healthcare landscape, and it uses a wide range of technologies, and it's in a journey to mimic a human brain and to create intelligent systems by using all the sorts of human skills like reasoning ability, problem solving, understanding natural languages. So in many ways, it is creating newer and newer technologies in every walks of life, as in healthcare sector also. But in machine learning, it's actually again, it is a cornerstone. It's a powerful tool with the help of AI, or it's a cornerstone of today's artificial intelligence revolution. Next slide, please. Okay, so this is actually machine learning. It's a technique under AI which is transforming the healthcare sector by enabling AI-powered tools to analyze the data, to identify patterns, and assist in various aspects of patient care, from the very diagnostic to the treatment. And it has its own terrain like drug discovery, so many health-related researches, and so on. And these advancements actually lead to more accurate diagnosis, personalized treatments, and improved patient outcomes. So many impact is there for this machine learning in healthcare scenario. So just to have a clarity, that is because many a times both the artificial intelligence and machine learning, we use it interchangeably or synonymously. But it is you have to understand these two are two different entities, where AI is a blanket or an umbrella term. All the technologies are there, but machine learning is a subset of AI, where we are utilizing the technology of AI to have its own purpose. So all machine learning is AI, but not all AI is machine learning. That is what the most important point. Okay. Then let's just go through the key concepts of machine learning. That is, next slide, please. Yeah. The major concepts under the topic or the discipline of machine learning includes, first one is the data, because we know the data is the buzzword nowadays, because everybody is we are concerned about the data, and so much of data is being generated, and actually we are living in an era of information overload. But we have to have the data is the cornerstone of machine learning concept, because only with effective data, machine learning can generate powerful strategies. So data, the machine learning, the technology rely heavily on heavily on data or large amount of big data. You might have heard the term big data analysis, data mining, and so on. So data is the cornerstone of machine learning technology, where we rely heavily on large amount of data to create and to improve, to create patterns, to make decisions, and to so on. So that is data. Next concept is the algorithms. Again, it's a such familiar word, algorithm. So this is nothing but just rules and procedures which is applicable to machine learning, and in order to analyze the data. Whenever the system or the technology is exposed to so much of data, it has its own rules and procedures to analyze it. Then only meaningful interpretations or meaningful conclusions can be made. So that is algorithm. Then third one is the models. Again, a much familiar term, especially during the COVID times and all, COVID pandemic. We have seen so many IIT, IIM faculty are coming and presenting regarding the prediction models and so on. So again, models is an output of machine learning algorithm, where that means what we have learned from the data, what we have processed out of the data, that is what is the model is. Then next is the learning, that is only the process, or that is what is happening. That is the system is learning the data and creating conclusions. Then generalization, again, that is the most promising thing that we can generate out of this machine learning. That means generalizing what the machine or the system has been learned from the data pool, and that is being generalized to an unseen data. That means for the future purpose. So forecasting for the future. So that is the most important aspect of machine learning. Then performance, that means in order to improve the performance over time, the system is hardly working on the data and creating generalization or forecasting. So these are the major concepts of the machine learning technology. Then let us see what all are the applications of machine learning in healthcare. The major applications include, so many applications are there, but in healthcare, the major applications include diagnosis and treatment, drug research, research and analysis, and others. So under diagnosis and treatment, that is the most important aspects are medical imaging, precision medicine, clinical decision support systems, then disease prediction and prevention. Let's see one by one, or the major important ones. So many applications are there, but as far as healthcare scenario is concerned, this medical imaging, precision medicine, then clinical data support system, and prediction models have much importance. Then obviously in drug research, machine learning has lots and lots of implications in target identification, drug screening and optimization, then clinical trial design. Then in research and analysis, like hypothesis testing, and to made the data analysis and pattern recognition much easier. ML is machine learning technology is being used. Then in the area of predictive analytics, and so many applications are there. So let us see. So what is being happening in medical imaging? And again, we know that the area of imaging, medical imaging, or the area of radiology, that realm is witnessing such a revolutionary changes, or because the technological advancements are created, such an advancements in the area of radiology. So when machine learning or the power of artificial intelligence come hand in hand with the radiological advancements, it is creating wonders. That is what is happening in the area of medical imaging, because these machine learning systems can extract valuable insights from the medical images. See, I'll quote one example later. So many deep learning models are there, which is these models or these systems are being trained on large pool of data sets, and which are capable of making or recognizing complex patterns and making meaningful inference for the patient. And sometimes this is beyond human potential. That is what researchers are saying, and which enhance the accuracy and efficiency of disease diagnosis, especially in case of rare diseases or rare kind of presentations. Then which enhances in the area of surgery, it enhances surgical precision by augmented visualization. During the surgery itself, the surgeon will be gaining augmented visualization with the help of this machine learning. Then better navigation assistance and better decision support for the patient can be made. so that the advantages are it reduces the procedural associated risk and which enables minimally invasive technique to maximize patient safety and improve surgical outcomes. So these are the advantages of that. So that is the importance of the technology of machine learning in medical imaging. Next slide, please. Next slide, please. Yes, actually, I was discussing about this slide, the importance of medical imaging, along with the technological advancements that is happening in the realm of radiology. Okay. So next slide, please.
Next.
Yeah. Thank you. So that in a systematic review and meta-analysis by Guha and all, they have identified, they have come out with a conclusion that this machine learning technology can complement radiologists to improve the accuracy of classifying GBM, that is a lethal tumor and lethal CNS tumor, glioblastoma multiforme. So they could identify that the radiologist could accurately classify the tumor, so that again we know that it will definitely have a great impact on the patient's clinical decision and outcome. So it reduces the cost of biopsy and unwanted interventions again. So this is a research finding, and so we have to but at the same time we should know that the role of radiologists, we cannot undermine the role of radiologist or the human element. Next slide, please. Okay, so next application is precision medicine. So again, the precision is the current word, because every technology, the newer and newer technology is replacing the old one in terms of precision, because we are looking for, whenever we are buying a product or whenever we are getting some thinking of some service, the first thing which comes to our mind is the word precision. So that is important. So the precision medicine, actually, a famous physiologist, Archibald Garrod, is who is the first person who coined the concept of precision medicine. That means, for example, if you are getting a fever, we are taking paracetamol. So that is a blanket thing. Like so many treatment that currently we are adopting is a blanket term, because we know that there are dosage differences. There are so many brands are available, but still some sort of blanket kind of practice we are following. So many factors are there. Traditionally, we are following that. But the concept of precision medicine, what they are looking at, that means they are curtailing, or they are they're tailoring the treatments according to the patient or according to the patient's specifications. That means there won't be any one size fits all approach is not at all recommended or not at all following in precision medicine. They are considering the patient's clinical characteristics, the personal characteristics, genetic characteristics, environmental factors, all the lifestyle factors. All the factors are there being considered under the precision medicine, and then devising an individualized treatment plan for the patient. That is what is the concept of precision medicine is all about. And these algorithms, machine learning algorithms, will analyze vast data sets and identifies the pattern, then plans personalized treatment strategies, then optimize the drug therapy. They'll identify what will be which drug will be the most useful or most effective in this patient. That may not be effective for much other patients in other population, but which one is the most effective one here? And then that will be administered, that will be planned for the particular patient. So definitely it will have patient adherence and outcomes will be there. So that is the importance of precision medicine. And we know that nowadays we are using in oncology, especially in the oncology area, targeted therapies, biotherapy is being administered to patients with so many oncological disorders, especially in CA-breast patients. We are HER2 positive patients, we are administering the precise medicine. So that is some kind of precision medicine it is. Next, please. Okay. So in precision medicine, we are considering about the personal thresholds now, again, as opposed to population threshold. That means we are designing the, for example, we are planning we are setting the serum cholesterol normal to person A or patient A to 180 or 160, like that. So that means we are, apart from the population threshold or a common or blanket threshold values, we are considering the patient specific values. That is what is personal threshold. And this personal thresholds we are setting or we are establishing out of the legacy data. That means the historical values we are collected over the time from the patient, from his family, from his all the sorts of internal or intrinsic and extrinsic variables. And we are considering if significant variations are there, then that we consider as a gross health status change. That may not be applicable to other rest of the population, but still we consider it as a gross health status change for that particular patient. So that is what is the importance of personal threshold in precision medicine. And again, study finding which reports the importance of CA125. We know that the importance of CA125 in detecting CA ovary, and they have identified that this CA ovary we could diagnose or we could detect CA ovary years before if you are utilizing the technology of precision medicine. Next, please. Okay, next is one of the most promising, especially nurses are concerned, we have a promising thing with the help of this AI and machine learning, that is the clinical decision support system. So we, as my previous speakers have mentioned, Dr. Kate has mentioned about the importance of nurses and importance of inculcating AI technology in nursing, day-to-day nursing, because we are the persons who are at the forefront of clinical sector in any hospital, and we are working 24/7 with our patients. So we know and always we work towards patient safety. And this is such a marvelous tool which enables to ensure the patient safety in our day-to-day work. It's actually a technology-driven tool in making informed decisions by providing relevant information and recommendations based on targeted clinical knowledge and patient data. So actually, which reduces, only thing, this is a system which enables the nurses to make informed decisions, knowledgeable decisions, responsible decisions to enhance and to ensure patient safety. This is actually so many systems are there. Again, I think in your institute itself, recently some system has been implemented. So that is to which reduces medication errors, which enhances patient safety, and it provides how it works. Actually, it provides real-time safety tips throughout against problems like drug interactions, because sometimes we may not be able to know whether drug A creates any interactions with drug B. But if the system is loaded with so much of knowledge and so much of data available, the system will trace, or the system will will give alarm. So see that A can cause interactions with B, and it can impair the patient's health status. So that is the importance. So it provides real-time safety tips against drug interactions. Then excessive dosing. If you have any kind of dosage errors, it will give alarms, or any kind of support will give. And duplication will be avoided through computerized. So many technologies are there, like computerized physician order entry, then electronic drug dispensing systems, then barcode point of care. So many technologies are available under this clinical decision support system. And this automated alert systems will reduce the prescription errors and dosing errors. And again, the most fascinating thing is that all these technologies can be ingrained or integrated with the electronic patient record or electronic health record. Again, a wholesome idea will be there, wholesome understanding will be there. So there won't be any chances or any loopholes will be there. Again, it ensures the patient safety. Next, please. Okay. And along with this, the CDSS can provide much implications in clinical management, diagnostic support, then administrative support. So all these aspects have impact by this CDSS or clinical decision support system. So like in clinical management, it supports in adhering to, we have got so many clinical guidelines and protocols. So this will enable us to adhere to the protocols, care protocols, and automated reminders will be there for testing, follow-ups, and specific treatments. Then and it bridges gap between guidelines and implementation. So again, the most important motto of any newer and newer intervention is to bridge the gap between the guidelines and the implementation. So the whatever being the experiment or whatever being the research, it has to come from the lab to the bedside. So that is what is being we envision here also. Then next is the diagnostic support, which the CDSS will enhance the clinical diagnosis by providing probable diagnosis that is again based on vast patient data. Then it creates administrative support by streamlining the supportive diagnostic and procedural coding, enhancing documentation accuracy, and automating the routine workflows. Next, please. So the rest of the thing applications include disease prediction and prevention. Again, as I mentioned about the COVID pandemic experience, we have got so many predictive. Often I wonder why in these COVID-related webinars, why this IIM faculty or IIT faculty is being presented. Because there comes the importance of the prediction modeling and these sort of technological backup. And we know that these technological advancements have given a leap for the healthcare scenario, and that is what is here also. That precision, predictive analytics or disease prediction has made tremendous changes in the healthcare sector. And in disease prediction, this will enable to identify the risk factors, or that means who all are at risk group, at risk category, and predicting the disease progression. This is again very important in outbreak, predicting some disease outbreaks, or certain population is at high risk for developing some sort of diseases, or detecting early signs, especially in disaster management or in climate change. These all have its own importance. So predicting diseases and also preventing. In preventive terms, this AI-enabled machine learning can plan person-centered preventive strategies. Then it helps to optimize the public health interventions and develop newer drugs and treatment protocols. Next, please. Yeah, predictive analytics, again, that is all about the disease prediction. So many examples are there. For example, if you are treating a patient with, or if you are a nurse lead of heart failure clinic, so many patients may be coming, and recurrent readmissions may be a headache for any nurse working in a heart failure clinic. So that is again. So with the help of this predictive analytics, we could identify what all are the group of patients, those who are at risk for having readmissions. Again, that will reduce the hospital workload, nurses workload, and they will have improved patient safety. Next, please. Yeah. So again, this machine learning algorithms have revolutionized the TB healthcare scenario of India. As far as India is concerned, we know that we have our healthcare sector is burdened with the magnitude of TB. So, but nowadays, so many technological advancements. This QRA, one of the most promising machine learning technology in India, which is practicing in India and rural Africa. So many technological advancements are there. Especially this TB we could detect TB within seconds, even within a minute. We could detect TB with high accuracy. See, over a lifespan of time, a radiologist may examine thousands or lakhs of films or MRI or CT or X-ray films. But with the help of this machine learning technology, the system may be able to examine millions and millions of data. So that is beyond the scope of a human potential or human life. So that is the importance of this machine learning, especially in low resource settings like India, where the burden of TB is a major health problem. And all the resource limited settings, like not only in India, the rural Africa, so many countries like where resources are limited, this AI can assure that the help of technology to enable better diagnostics and better treatment protocols. And which detect TB within seconds with high accuracy. It reduces dependence on specialized radiologists. Again, health manpower is a major issue in many parts of this globe. So the help of AI or the machine learning will create its own impact. Then make mass screening more affordable and efficient. These all are the advantages, or these all are the benefits of machine learning in the healthcare scenario. Next, please. Okay. Then again, the availability of ICU beds. Again, it's a major issue, especially in tertiary care hospitals and in times of a pandemic. This is again an issue. So this technology will help us to identify the patients who are having much survival potential. So to categorize or to give beds to those who are needy, again, this will help us. So how this technology will identify or make this kind of conclusion? That is from data. As we have mentioned, one of the major components of machine learning is the data, because only through data, if the adequate data is there, only that machine or the system can make its own conclusion. So many the data sets are there, like vital patient, if it is in case of a ICU patient, or to determine the acuity index. There are vital signs, then nursing assessment data like neurological assessment or cardiological assessment, then all the sorts of assessment findings, then laboratory investigations. So by compiling all these data, by analyzing all these data, the machine could come with meaningful conclusions. So that is what. Next, please. This is one of the major examples, that is IBM Watson. It's a medical AI. Then coming to the next, please. Yeah, next one. Yeah, thank you. Then coming to the applications of machine learning in the area of drug research. Again, we know that the randomized control trial, or RCT, or the clinical trials are the only through clinical trials we are devising newer and newer drug forms, and we are answering to the clinical challenges often. So that is in case of drug research, the AI machine learning algorithms will help us to identify the potential drug targets, or which category or which group of patients are the most appropriate targets for a particular drug, and with greater efficiency and accuracy. Then predict patient outcomes in clinical trials. So what may be the outcome? So that could be predicted, and so that unnecessary sampling or unnecessary exposure can be avoided. Again, it reduces the resources. Then analyze extensive data sets. Again, multi-centric studies may have extensive data sets. The machine learning algorithms can better analyze the data and come with meaningful conclusions to predict potential. Again, to protect, sometimes if the patient or the population is exposed to a newer kind of drug, again, we may not be able to know what all are the dangers. So being a low and middle income country like India, often we confront with so many clinical trial, evils of clinical trial. So these all could be avoided with the help of machine learning technology. So that we could. Sorry. Time is over.
Please go ahead, ma'am. Go ahead, please. Please go ahead, ma'am.
Yeah. Okay. Sorry. Okay. So that's about the drug research. Then there are so many tools for other sectors also. So let us just see what are the challenges of machine learning. As I think my previous speakers have mentioned about the data issues, lack of sufficient or high quality data is there, then data variability and bias, then exclusion and sample bias. We may not be able to know whether the representative population is there, the data that the system is looking for. Then the measurement bias, so many data issues are there. Then ethical and legal concerns. So nowadays the ethics in AI practice is a major concern, because we are handling with patient sensitive data. So that kind of ethics and integrity have to be there while dealing with the patient's data. Then how far we could adopt in a resource limited country like India. So these all are the major factors we have to consider. Financial barriers, interoperability, then resistance to change. These all are the factors we have to consider. Then the performance of the system, how far we could able to generalize the finding which we have derived out of. Again, these are the challenges we are, and then cyber attacks. So that that kind of foolproof systems we need in order to have this technological advancements or go with this technology. Then again, human factors are there. As our director has mentioned in the introductory talk, we cannot replace the human element if our AI is technology is there. We have to go in hand in hand with the technology. That is the thing. Then again, coming to the last part of my presentation, that is the future of AI. So many researches are being undertaken in all the aspects like precision medicine, predictive analytics, and this health monitoring and all. So it all gives a promising results as far as the results are concerned, because with the technological advancements. With the technological advancements, we could ensure patient safety, we could reduce the workload of nurses and healthcare sector and hospitals. But we have to see we have to see how far the practicability or feasibility of the technological advancements. Next slide, please. Next, please. Next, please. So to conclude my presentation, we cannot deny the technological advancements at any cost, but we have to go in par with the technological advancements, but by keeping the human element along with, because being nurses, we cannot deny the human element. How far the technology is advanced, always we have to be there with the patient with a human touch. So by this words, I am concluding my session. Thank you, the organizers, for giving me an opportunity, and nurses, happy Nurses Week to everyone. Thank you.
Thank you, Radhika ma'am. That was so amazingly explained. We always trust your, knowledge and presentation skills to just pump up the entire event. We all know how about your potential, and you have just made it double the expectation from our side, ma'am. So thank you. Thanks a lot. We have yes, I will.
According to Benjamin, an investment in knowledge always pays the best interest. Expressing our sincere gratitude to you, Radhika ma'am, for sharing your treasured and relevant wisdom with us. Thank you so much, ma'am.
Thank you.
Inviting Madhuri Smith ma'am, Deputy Nursing Superintendent, SGPGIMS, the caring and sincere personality who received Florence Nightingale Award by the President of India for an endless and effective nursing care, to moderate the next session along with the jovial, energetic and vibrant Alka Mohan ma'am, Deputy Nursing Superintendent of SGPGIMS. We are privileged to have our next speaker, strong roots of College of Nursing, SGPGIMS, whose constant guidance and effective management is enabling the College of Nursing to soar to new heights. Inviting the cherished Dr. Radha K. Ma'am, Principal, College of Nursing, Sanjay Gandhi Postgraduate Institute of Medical Science, to enlighten us on the topic Artificial Intelligence in Nursing Education. We wholeheartedly invite you, ma'am.
Very warm good afternoon to everyone present in this webinar. I would like to, first of all, I would like to thank the service cadre of SGPGIMS. They are doing a wonderful job, because this kind of activity, they are long, big program. This is a big program. Entire week, they are engaged in a different dimensions. And really, I thank to entire team of the service cadre of SGPGIMS. And one more thing, they have given me an opportunity to present, and with them, they have taken me also. Thank you so much. But this talk, I would like to start my presentation. My topic is artificial intelligence in nursing education. So before start of my presentation, I would like to put a disclaimer, because this contains, I have taken it in a different sources, and even I used AI tools also. And this is, I cannot take a guarantee for taking the ownership of this content. And please ensure with the original sources. So with this disclaimer, I would like to start my presentation. So the presentation contains AI in nursing education. So what is AI, history of AI component, applications, opportunities and challenges and solutions, and that questions from the participants also. So the introductions, the artificial intelligence, I think before me, so many presenters, they have taken it in a different dimensions of AI. And AI, it is a rapidly transforming healthcare, and its potential in nursing education, and equally revolutionary. So from the personalized learning to smart administrative systems, AI is just playing in a different role, and we know we have to accept it with the acceptance. And just I'm proceeding my presentation. And I think Sujayam and Dr. Sujay, she was asking the questions, what is artificial intelligence? What do you understand first? So like Radhika madam is also cleared about what is artificial intelligence. It is a simulation of human intelligence process. So by machines. So it is like triggering the human intelligence or simulation of human intelligence by using of machines. This is a simple understanding. We can take it artificial intelligence and beyond the potential of human capacity. So the machines are working. So that the definition of artificial intelligence. And if I just scrolled what is intelligence, artificial intelligence, and when it was started, I was surprised to see Alan Turing. It's 1930. It was contributed this pioneer. He was started the word of AI, computing and AI. So the concept was clear the way back the 1936. It was amazing to see AI. Now it is a blooming technology, and everyone's talk about AI. But the way back it was started, and why it is not inculcated in our this one so many years, we have skipped it. So this is somehow the gap existing in AI, inculcate in intersections with the healthcare systems. And who is coined the artificial intelligence? Who is the father of artificial intelligence? The John McCarthy. So he was coined the word of artificial intelligence. So thanks to this legends they have coined, and then they have contributed a lot to the world. And I think these all the terms, repeated terms we are hearing since morning, and machine learning and the neural networks, natural language processing, computer visions, and robotics. So these are the key component of artificial intelligence. So machine learning, I think Dr. Radhika ma'am was very clear what is the machine learning, because machine learning needs a lot of huge data. So the data, we are just putting it into the machines so that the machine will just give over the time, it will be programmed. So this is called machine learning. And the neural networks, it is also one type of machine learning and inspired by human brain, because how the brain branches, it's there, that way the machine is also inspired. So the neural network has come up. So the decisions is based on the input data or the loaded data, the way it will be projected. And natural language processing, again it is like human language, whatever the language we speak, that way it will emit or mimic. So that is natural language processing. That is also the component of artificial intelligence. And the computer vision. So this also one component of artificial. Am I audible?
Yes, ma'am.
The computer vision, so AI that enables the machine to interpret and understand the visual world. So that is also the computer vision is also the key component of artificial intelligence. And another version of the artificial intelligence is robotic. So robotic that also can perform the automatizations and the minimizations of the workload of the human. So that's also, these are the component of artificial intelligence. So just this slide speaks about application of machine learning, where all in the world or in workplace or in different systems, it's how it's working. Like in speech recognitions, image, medical diagnosis, online fraud detections, virtual personal assistant, email spam and malware filtering, product recommendations, like any product, if you want to recommend it based on machine learning, already loaded data, that way it will project what kind of product be needed. And medical diagnosis, self-driving cars, and all cars, it is enabled with the machine. So that is self-driving cars, traffic predictions, and automatic language translation. So these are the common areas where the machine learning is applying. And application of neural network, again, it is facial recognitions and the stock market predictions, social media, aerospace and signature verifications and handwriting analysis, healthcare, defense, and weather predictions or weather forecasting. These are the areas the neural network is working. And AI in natural language processing, then again sentiment analysis, text clarifications, text extractions, market intelligence, hiring and recruitment, customer support, email filters, speech recognitions, and machine translations, and chatbot and virtual assistants. So these are the common areas where the natural language processing is applying. And again, it is natural language processing, the text input, text pre-processing, text representations, and future selections, model selections, and training. Then again, at employee deployment and inferences and evaluations, optimizations, and iterations and improvements. So these are the common areas. Again, it is NLP working. Then computer vision, you just imagine the computer visions when you put the object, then sensing, again the camera will be there, sensor will be there, both they can work it, and it will go into the machines like the processing, the output it will be show as the apple. Like in facial recognitions also computer vision is working. And when identifying any of the items, so for example, biomedical waste management, when you just show any of the like a needle or syringe, so the processing will take it by the sensor and the camera. So the output will be show this has to go ahead yellow bin or blue bin. So in which way the computer vision is also working. So that way, I think these are the component we can take it into our healthcare systems, especially in nursing field. We can adopt majority of the component. And now main talk of my presentation is application of AI in education. So where all in which areas the AI is working, like in the learning platforms and the tutoring systems, personalized learning. Since morning, we have been just continuously hearing about personalized learning and classroom management, adaptive learning, assessment, education use cases, education applications and technology, then the prediction of the education trends and education research, then teaching and learning process. So these are the common areas where AI is working in the nursing education field. So like benefits, what benefits in personalized learning we can get it? Because when we go through as personal or as individual, definitely I can get motivated and interest and engagement. So these are the three elements which we will get benefited out of the personalized learning. And also the outcome of these inputs, definitely some sort of outcome, efficient outcome by the learners. The learners may be the student or the nursing educators or whoever learning, anybody, the nursing officers, whoever is learning through personalized learning, definitely the outcome will be the efficient and quality outcome will be emerging. So here, some component I just mentioned here, enhanced efficiency for educators. Definitely, when go ahead, the AI or AI applications in education, automatic grading system can be dealt. For example, when you put the data for 500 students or 1000 students, so the automatic mapping will be there by machine learning. And the grading also will be there first semester, second, third, and fourth, and no need of calculating for every semesters. So automatic grading systems will come. So this will boost up to the educators. They can predict it according to the students' level of understanding or else the grading of the students. So the predictive model is also working in education, nursing education. And also the better understanding or better decision. The data is always giving some kind of driven to the nursing educators. Yes, this student needs to improve their academic, or these students can go better about their learning. We have to give so many formalities or so many assignments to improve their efficiency. So this data definitely will give some kind of direction to the nursing educators to improve the efficiency of the nursing students or the learning ability of the nursing students, and also increased accessibility. So AI, when you just inculcate AI in nursing education, when the students are reading their own language, definitely their motivations and also their engagement will be high. So increased accessibility of the students will also boost up the AI if you inculcate AI in nursing education, and also the smart content creation. So when in our time, if you just want to create any content, we have to sit for a month or for a week. So we have to complete one assignment. But now if you give any kind of assignment to the students, within a half an hour, within 30-20 minutes, they will just bring in a different dimensions of content. The nursing educators, we are amazed to see such content because their students' ability to explore the AI content in different directions. So that we are facing, really amazing to see the students are exploring the AI content. So the smart content creations also the AI can be used, and cost effectiveness. So here definitely the AI integration into nursing education's cost involvement will be there. But at the same time, we need to explore what all the cost containment and cost effectiveness mechanisms we can use or adopt in the AI in nursing education for the better understanding or better learning of the students. So, and the next point is 24/7 learning supportive systems. So the class, when you just start 7 o'clock and ending with the 3 o'clock or 4 o'clock or 8 to 4 or 9 to 5, whatever it is. So when it is the class, theoretical teaching has finished, the students, if they go to the home or the hostel, definitely the learning environment, only the books or the mobile phone. So when you just inculcate the AI supportive system in nursing education, the 24/7, the content will be available. Whenever they get the time, they can explore, they can just read, they can go through the content. So this also very useful if you just integrate AI in nursing education. And improved engagement and motivation. As I said earlier, so this definitely when you scroll yourself, when you explore yourself, definitely the engagement and the motivation is high. Because one student has completed, another learner is also striving too hard because my content is different than the other learner. So the improved, it definitely it boosts the students' engagement and motivations, and improved assessment and feedback. So when personalized learning or automatic AI system for the evaluation, so it gives enough assessment and feedback.
ఫస్ట్ ఫ్లోరా గ్రౌండ్ ఫ్లోర్ లో ఏదో ఒకటి పెట్టారు సెకండ్ ఫ్లోర్ లో ఇప్పుడు పెట్టి వచ్చాను ఫస్ట్ ఫ్లోర్ కదా ఉన్నది
So these are the common areas, and if you just work it out, the what kind of benefits we will get out of it. So that just I have projected in the slides. And coming slides, so this is like some of the tools which we can use it in the classroom. Definitely everybody as a nurse educators, ChatGPT and the learners is also aware of it. So ChatGPT, then QReport, then Perplexity, Education, Coplat, then APT, Killboard, that's a common paraphrasing tool. And the PowerPoint, if anybody they want to prepare a PowerPoint, and then PowerPoint coach is also helping. And Grammarly, many people you might have using this one, Grammarly. Canva is also, and YouTube summary, then slides AI, then another tool is also added. Then Speechify, Dale, Canva, Magic Write. So these are the some of the tools which we can just use it as learners. Definitely within a stipulate like a 5 minutes, 10 minutes, we can create a very good content. And even PPT, the many advertisement you might have seen in YouTube, within a minute, within 30 seconds, within 20 minutes, 10 minutes, you will come up with good content, good PPT like that. So these are some kind of AI tools. Really, it helps us to learn in a better way. And I think AI applications, Radhika madam has covered a lot of things she has covered in a comprehensive manner. And only to reiterate our content, I would like to say about where all the AI applications in healthcare, clinical decision support, predictive analytical and patient monitoring system, and CDSS, adverse drug reactions, then automated medications dispensing system, AMDS, robotic assistants, robotic process automations, robotic again assistants, and a drone. Drone is also one of the AI enabled drone. In many of the AIMS, they have inculcated a drone facility also. So AI inculcated in a drone for dispensing medicines and to take any of the investigations or some of the blood reports, any kind of report. If you want to collect from the hilly areas, the drone will come and will go and then collect. So these areas, and if you want to give any disaster training for the students, definitely this drone is also helping. So drone AI inculcated drone is also helping in learning. And this is like a research part. And some of the tools I would like to say which are the tools it's really helping for the researcher, nurse researcher. And I think some of them you might have heard this the tool which really helps for research, review of literature or some manuscript or PDF, full text PDF collections. I think literature search for the literature search. Size space, it is one of the tool, AI tool. Definitely, there's many of them we are aware of it also. Then consensus, perplexity, discovery, site. So these are the some of the literature search. Definitely, which is it. And then connected papers, lit map, reading paper, Inogo read, size space, scholar Chi. So there's also knowledge maps in the connected. I think for one of the manuscript, I have used connected papers. So connected papers, when you just put any of the statement in the connected papers, automatically with all related literature, it brings into a neural network type. So connected very close to your paper, which all the papers, it is available in your database. So the connected paper is also, it is one of the tool which really helps for the nurse researcher. And the note taking for any note taking or rewriting the content, paraphrasing, the Jenny AI, Tringa, then Pepperfall, then lateral, clasp. These are the some of the tools really helps for the nurse researcher when they are publishing or creating the manuscript, writing a manuscript or publishing any paper in the journal. So these are the some tools which really helps us to improve our own efficiency. Then in India, I would like to emphasize some of the opportunities and learning platforms which are available in India. Niti Aayog. So Niti Aayog, as per the Government of India, Ministry of Health and Family Welfare, they have started Niti Aayog. So that is AI for all. So the AI for all means Government of India has thought of vision to create every citizens and lay people, they also get awareness about AI. What is AI awareness? And the literacy about the AI, everybody should get the awareness about AI. So this is the one opportunity every citizens of India, they will get to explore about AI. And next one, it is Saksam portal exclusively for nursing persons or nursing personnel in India. They can access the Saksam portal and it is a free of cost. The India Government of India, it's an excellent initiative. So they have started e-nursing courses development. So you can just scroll it, any of the content, you can just get downloaded and you can view also. So this is an excellent portal for nursing nursing personnel as well as the other healthcare providers also. And next one, it is National Educational Technology Forum is also offering many AI tools and the teaching, learning process, how you can make your betterment of classroom management with AI tools. So, and that is also working. And Diksha platform, this is also Government of India initiatives, digital infrastructure for knowledge sharing, and you can just take any digital text, video, teacher training. So if you just scroll Diksha platform, and definitely the teachers also get many ideas and many explorations. And this, I would like to say, one nation, one subscription. This is a recent Government of India initiated for the healthcare providers, researchers, because subscription of database to the institutions, it is very difficult. For any of the institutions to take this burden. So the Government of India has taken a good initiative, one nation, one subscriptions. So all government institutions, they can just get the subscription of all articles, databases, many of the databases. So this way, this also we are getting opportunity. And one nation, one digital platform. This is also Government of India initiative. And Swayam Prabha online courses. This is offering an excellent opportunity for any of the learners, because you can just complete 3 months course, 2 months course, 1 month course, free of cost. With free of cost, they are providing an excellent opportunity, even soft skill, leadership, then research, then we can just education, teaching, learning tools, many of the tools. I think this is very, what I could say, that it's a great opportunity. Every nurse, educators and nursing personnel, we should make utilize of this opportunity. And Nisita, National Initiative for Schools, Heads and Teachers, Holistic Assessment, and e-Pathasala is there, e-Vidya is there, video conferencing and digital whiteboards for virtual classes, recorded lectures and flipped classrooms. And now I'm just coming to the point of opportunity. It's a great opportunity. Iris, the first AI generated educator with robotic systems. It was started in the year of 2023 in the state of Kerala in India. It is a very good opportunity. The robotic act as a educator. So it is the students also get admired when a robot, if it comes, and then teaching, and whenever you ask questions, and based on the data inputs in the robotic, in which way it also tell the answers. So I saw Iris, it's working quite a lot. So this is the kind of opportunity without much budget. You can just make utilize of it, whichever it is of available resources. And now it is the what you can say solutions. So how we can just make solutions when challenges are facing. I think we can just many challenges we are facing right now because of AI integrations in nursing education. It's when you talk about the challenges and opportunities, at the same time, we need to find out the solutions, what we can just remedial measures to inculcate in a better way. So bridging the digital divide. Bridging the digital divide means, as I already said about in previous slides, there are a lot of opportunities, quite ample of opportunities is available in India. We have to make sure sensitize the students to utilize the available resources first, because the students are just grabbing in a different directions. We need to direct them what are the learning opportunities available. So in which way bridging the digital divide, so the AI for all or the digital literacy for all, we have to make sure it. And advocate for institutional grant for supporting the technical infrastructure. So now in India, as per Indian Nursing Council, all the nursing colleges, previously it was not existing the skill lab or the simulated lab. Now every colleges, nursing colleges should have the simulated lab or advanced skill lab. So this, it is not, doesn't mean that you should have the simulation center. It is heavily budgeted skilled lab. But you can just low mannequin or low simulated mannequin also, we can just take it. So this way we can just advocate the institution to grant to support the technical technology integrated infrastructure. and seek technical and health integrations. Here I would like to just to say, discuss the things. We always, the health, it's not a separate kind of things. Now it is because of AI integrations. We need to seek the integration between technology and the health system. So whenever we get any innovations or ideas, we need to go and just talk about the technology people, IIT people, or any technologically advanced people, sit together what we need really and what they can do it. So that way we can integrate it. That is also a solution for this. And use open sources and low cost, free of cost platform where appropriate. So it is first make sensitize the patient, which all the sources really available, low cost available, which we can just hire it, and which we can just exchangingly informations we can cover it. So that way we should get awareness, nurse educators, we should aware first, then we can sensitize the students and share the resources through inter-institutional collaborations. I think this webinar is also very good example for this AI integrations. Like for example, exchange of the US people are sitting and then exchanging the ideas. Now we are sitting in the place of Lucknow and we are exchanging the ideas. So now we are exchanging the information about AI. So the sharing of resources also in such a way we can do it with low cost. And cyber security and privacy. So we must know what all the privacy measures and encrypt measures protocols are there. And at the regional level or the state level or national level, we must frame the guidelines how we can work it out with a safe manner with the AI integrations. And integrate communication, empathy, ethics training in digital modules. So like we should not leave our empathy, communication, because these are the core essence of the nursing. So we cannot leave without neglecting all these elements. We cannot only behind the digital and the AI. So this also we have to start to think to integrate the communication, empathy and ethics. And use simulated patient interactions. So AI Avatar, it is working, and we have to inculcate the soft skill, empathy and interactions, patient interactions, standardized patients, so to practice all those things. And balance digital learning with in-person clinical rotations and mentorships. So this we 50-50, like you have to balance the person as well as the AI, integration of AI. So this way we can just balance it, where which area we need 70-30, 80-20 or 50-50, like that. So that depends on the mentor or the supervisor to decide. And the student exchange program and faculty exchange program. So we need to aware of it, AI integration into nursing education and nursing service side. So the student exchange program and faculty exchange program, this is also a solution we can take it. And collaboration with IT professionals, grant projects, innovations, call for suggestions, call for innovations, call for research activities, so that what kind of innovations we can bring into nursing education, so that way we can do it. And startup for digital innovations. So we can just start up, we can mold the students, you can come with some ideas, innovative ideas, make them to do prototype. Some startups also we can just encourage the students, they can run startup this also. So that way we can digital innovations, we can bring it. And incorporate evidence-based teaching practices and regularly assess learning outcomes. Use blended learning to combine technology and hands-on training. So hands-on training and the combined technology. So blended learning, it's a kind of blended learning. We cannot go alone with the AI. We cannot go alone with the hands-on training, the traditional method. We have to blend the learning, blended learning. It is also one kind of solution for this AI integration into nursing education. And the area where the administrator or policy maker or the manager, nurse manager, they have to look what kind of SOP is available, in which way the learner they can use with safely the AI. So the policy we have to make it, SOP we have to develop, and accrediting agency, they have to look at what kind of AI integrations now we have to embrace in nursing educations. So along with some accreditations items, this also we have to bring it into the accrediting checklist. And cybersecurity and robust assessment. So these are all some kind of solutions. These all the solutions I could say, but in which way we are taking it, since that's different. And now the challenges, definitely, as Radhika madam was saying, AI, it is ethical concern, because the ownership who is hold, like for example, if I have taken it content, who is taking the ownership, whether I or you or the AI, who will take it, that ownership of this content? So that is one kind of challenge we are facing. And the relevancy, the increasing relevancy, because more complex works and ethical questions will more significantly is coming. So relevancy and authorship issues and intellectual property issues, it will come, and risk of bias and misinformation. So because misinformation, the communicating the interpretation of misinformation, it's AI systems, because the loaded data, whichever the algorithm made it into the machines, in which way it will predict it. So the risk of bias and misinformations and the transparency, AI, definitely we are facing the fairness and accountability, who will account, holding the accountability. So that is also one of the challenges. So again, it is ethical considerations I have talked about. The best practices, what we can do it in nursing education. So this is like use AI as a supportive tool. As Madam previous speaker also was talking about, AI we can take it as substitute. AI, it is a supportive tool. We can take it is a supportive tool. It's like we cannot replace it our own thinking, because it is, we can embrace our own thinking, enhance our own decision making support. We can rationalize our confidence. We will get confidence by using AI. So it is not replacing entirely our own thinking, human thinking. And use AI for academic collaborations and enhance efficiency with research assistants. Definitely, if you use it AI in a better way, we can just bring it, and your efficiency of your productions or the research, whatever it is, definitely will be high. And verify AI generated information. And always we should have maintain academic integrity, because academic integrity is the core part of our learning. So maintain academic integrity, that way we can just practice it. And develop a personal writing voice. Whenever we use any kind of content from ChatGPT or any of the tools, AI tools, you just sit and just use your own thinking, your own voice, your own touch, personal touch of writing, personal writing skills, voice. So this way we can just best practice it. And counterbalance AI assistance with the personal editing. If you just edit and just supervisor or your own mentor, you just show and then you counterbalance it, your content, and stay informed. If I just use this tool, don't shy enough that I have taken it. You just stay boldly that I have taken this content from AI tools only, right? So stay informed about AI tools and developments. Stay with the boundaries of your own field, and no need to go for one content 24 hours, 36 hours searching. So you stay within your boundaries, what limitation of your content and content requirements. So stay within the boundaries of your field. Respect ethical standards. Always the integrity and ethical standards go hand in hand for the effective teaching and learning. And at last, I would like to say, it's not a question about if, but how well, right? So it is, you don't ask if, what if, and then but well, right? So don't ask, it's not question about if or but well. But only thing is, when you use it in a personalized learning, definitely you can just strengthen your clinical preparedness and optimize academic and administrative operations. And now AI can serve as a co-pilot. Since AI can serve as a co-pilot, you can just transform your educations in a more inclusive, innovative, and impactful journey. Let all embrace our transformations, not for the sake of necessity, but an opportunity, because we are getting an opportunity, we are utilizing in a better way. And however, technology must never replace the human touch. We all know, we all aware of it. We cannot or we never compromise the essence of nursing care, compassion, commitment, quality, comfort. We cannot compromise. We never compromise. So these are the core values of the nursing. We cannot replace by machine with right blend of innovations, ethics, human-centered care. We can ensure the AI not only enhances the nursing education, but also help us prepare a new generation of nurses who are both technologically adept and deeply compassionate. So with this, I would like to conclude my talk. These are my references. Thank you. Thank you for kind listening. Thank you so much, ma'am, for your nice and wonderful presentation of AI in nursing. You have explained very well about AI in nursing and the application of all component of AI and also application of AI in education and also in service education. So we are very grateful to you. Thank you so much. Thank you. Thank you so much, ma'am. Thank you very much, ma'am. Your presentation very knowledgeable. Artificial intelligence and education. Thank you very much. Thank you so much.
Education is the move from darkness to light. Thank you, Radha K. ma'am, for being that ray of hope for all those traveling in the dark. May the light you shared shine in all our minds and heart and bring out a positive change in our professional career and our personal selves. Thank you so much, ma'am. Moderator for the next session is a genial personality whose knowledge and steadfastness spreads a positive ambience wherever she goes. I would invite Mrs. Merlin Chima ma'am, Senior Nursing Officer and Teaching Faculty at College of Nursing, Sanjay Gandhi Postgraduate Institute of Medical Science. Our next speaker is a hardworking person whose persistent efforts had led to today's webinar and many other scientific sessions. He requires no introduction, as his presence itself is a boon for all the nursing cadre. I wholeheartedly welcome my talented colleague, Mr. Dikhil CD, Infection Control Nurse and Senior Nursing Officer at SGPGIMS Lucknow, to share his views and throw light on the topic Artificial Intelligence, Ethics and Regulations. Welcome, sir.
You have to moderate him. No issue, madam, ne moderate kar. When he finishes, then you have to say something. You tell some. He's talking. Ritikil, just a second. She is just. Okay. Very good. Good afternoon, everyone. First of all, I would like to thank the organizing team for choosing such a wonderful topic, artificial intelligence in nursing, because this topic is most relevant and needed topic for the current scenario. And I also thankful for inviting me as the moderator for this topic. So I would like to invite Mr. Dikhil CD, Infection Control Nurse, SNO, SCPGMS, very much renowned speaker present in the midst of us. I would like to call him to talk on the topic artificial intelligence and what are the ethical considerations to be followed while using artificial intelligence in the nursing field. I welcome, sir.
Thank you. So kind of you talk so good about me from such a wonderful person. It's all
अभी बारिश हो रही थी इसलिए चक्कर में तो सबको पैदल आया अब एक भी नहीं ले जाएंगे मेरी तो जाएगा फट गया तो अलग रखे हैं आप बिल्टी बैठेगा शाम को खिला देना रोटी पे कुछ नहीं पानी पियो ना चक्कर चक्कर
Am I audible?
Yes.
I hope I'm audible to everyone. Let me start the presentation. Lot have been discussed and taught by eminent resource person uh, before my talk. So
रात
there
तो
is
नहीं मारा
nothing.
हाँ गर्मी पड़ रही है यार कड़े छिपा के तो नहीं
Nothing left much for me to talk on, even on this specific topic of ethics and artificial intelligence. But before going further, we all know artificial intelligence have, capability of a demon. It can kill you, it can take our jobs, it can make you, for a maybe a nuclear fallout, maybe even worse than that. Even, I want to quote Elon Musk, who is, doing a Neuralink project in USA. He said that even the artificial intelligence has got the potential of wiping out the humanity even more than nuclear weapons. We need to take that notion very seriously, because we don't know. They can have, eyes of thermal detection, which we human beings don't have. They also can have many other features which we do not know right now, and they can scan us even wherever we hide. They can scan all around us and they can kill us. So these kind of things are coming in the future, which we only see in the Hollywood movies. It is about to come. So how we can prevent it? There were enough discussions, like should we, totally step away from the advantages what AI is offering to us, or should we embrace the advantage along with this demonistic properties? So with this, a lot of discussions were going on. So many countries sit together and they discuss, and still it is going on. Initially, people thought that we will stop AI, we will stop making robots, we will make sure even if the robot takes on, it doesn't learn by itself, it doesn't get any emotion. All those things were discussed, but once it is moved, it is moving on. Apart from that, there is another question of data. Do you want your data to be taken by an AI and just make another robot exactly which look like you, feel like you, speak like you, and moving around in the society and doing notorious things which robot itself or somebody else want to do? None of us want that. All right. So these kind of issues are going to come with the robot, and it's the future. So in this point, with profound ethical imbalance, the countries sat together and they came a lot of issues. I request everybody to keep their mic mute. So in coming to healthcare field, we are going to talk about the ethic part of only in the healthcare field. No other field has more than, ethical compass more relevant than in artificial intelligence right now. We have so many monitors which record the data. We have so much of, fear, anxiety related to the disease. And you just imagine if one can identify everybody when you walk in a society, this person got this illness, this person got this illness, how will you think and treat that person? Even, if somebody has got HIV AIDS, still the stigma survives. So all these things are going to be, very much available for everyone in the near future, if not in already. So these things are going to come with a lot of bias, discrimination, fueling divisions, threatening of fundamental human rights and freedoms. All these things are going to come. So the various government took measures how we can, reduce this. So they came out with a UNESCO guidelines. Out of that UNESCO guidelines, there were various sections, out of which one section entirely dedicated to the ethical part of human health. It came with 10 points. These UNESCO guidelines help every country to develop their own rules and regulation or law. In India, we don't have any law, or particularly to artificial intelligence, which is evolving right now. We do not have, but they gave certain guidelines, and I will just try to discuss the guidelines very crisp manner. In that guideline, section 11, 121th point, it is highly available in the net. If you just search, you will get. One of the point is be consistent with international law and human right law obligation. That every country has the right to ensure that the AI system or any AI robot, anything which is related to AI, be must consistent with international law and human right law obligation. That must be a must. That is the first recommendation by UNESCO to all the member countries, which almost every country is a part of. 122nd point is the consideration to the mental health. Most of the time, machines do not consider the mental health of human beings, and which also advocates for the attention to the children and youth. Maybe machine may be considering we all human beings as one, but we are not one. We have children with multiple thoughts and dreams and imagination and the willingness to play. We have different age group people with a different milestones to achieve, different thought process, different motivations which drive them. But machine do not discriminate all these things. They may consider all as one, and artificial intelligence may consider all of us one. So all systems must address the mental health, in particular, paying due attention to children and youth. That considered the second thing. The 123rd point requested to ensure the member state that regulating, predicting, detection and treatment solution in the following part. First point, what they said, that it should minimize and mitigate bias. It should not, regulate, he's white, he's black, he's Indian, he's Chinese. That bias should not be there. Sorry. Second part they advise for is the always consider domain expert in developing algorithm. Let me give you an example. When I was talking to my friend, Vipin Paul, who was about to come and join today, so he gave me an important insight. Google developed a AI system which will provide some kind of healthcare service to the people who require it, and they put the name as a nurse. The system itself is some term they use, and then they termed it as a nurse. Even now, the problem, the jurisdiction has been thought of it, and the problems are going on to remove the word nurse, because it's like almost removing the nurse. That AI system is not going to replace the nurse. We are thinking we are human beings, that is going to be a machine, but still these people with clear-cut profit-making thought process, they have used the word nurse. And we have trained for 4 years, and there are certain things which we only as human beings we can deliver. But still they have, had the audacity to use the word nurse. So that is absolutely illogical. As a collective profession, we have to stop it. And now another one parameter is, most of the time when the coding happens, algorithms are developed, who is being called? Are the nurses involved in it? So this guideline suggests, this part of the guideline suggests, always seek domain expert in that particular part, especially in the healthcare. We have, multiple healthcare sections with us. Now, another one is the breach of privacy, which we all know it should not be, discussed, and personal data. And final decision of diagnosis and treatment must be given to a doctor. Although we can, take the help from, AI systems, but these guidelines suggest that final decision should go to, of diagnosis and treatment should go to a doctor. Another one, and the final one, was a review of AI system by a ethical research committee prior to clinical use. Every country are requested to make a guideline for this. Otherwise, there will be, usage of technologies like what we saw in World War II. Human beings will be treated like, experimental animals. So that should not be the case. So ethic committee should review all the ethical system before its use in healthcare around the world. So this was the 123rd point, and this is the most elongated point. Otherwise, the points are very less in comparison to that. 124th point, research on effect of regulation of potential harm to mental health related to AI systems. This must be studied after the implementation, and necessary changes should be done. This was one of the guidelines by UNESCO. And another one is, there must be a guideline for human robot interaction. Human robot interaction is going to come. You will see the robot in your delivery boys who comes to your home. You will see that you have already started to see the chat boards. If you want any common answer, chat boards started to help. You have Meta right now. You can ask anything. It will come in the WhatsApp chat board already. So these kind of things are going to come. But when it comes to healthcare, you should develop a guideline for human robot interaction. I'm sure in India or in any countries, it's going to come in the very near future. Next one is human robot interaction comply with the same principles and same values that apply to other AI systems, including human rights, fundamental freedom, promotion of diversity, and protection of the vulnerable people. This is going to be a challenge. You are going to see, the things like what we saw in Bollywood movies, if it is all these guidelines are not implemented. Next point is whether they can easily identify whether the system what you're interacting is human or an AI. That's going to be a real tough in the near future. The neurotic system, what is being developed, and the artificial system, you will not be able to differentiate whether it's a bot or whether it's a human being. So there must be some differentiation. This is artificial intelligence. This is human. There must be some guideline that is being promulgated by UNESCO in this point, 127. Now coming to 128 point, it is the rise awareness about anthropomorphization of AI technology. What does it mean, anthropomorphization? It is the transformation of a robot into a human being. We don't want that, right? We don't want, to take away human lives by a robot. That should be, sorry, enough awareness campaign should be done on that. And language, including the language used to mention them, and possible limitation of such anthropomorphization, in particularly in the context of robot human interaction and when children are involved. Thank you. Next, the second last point is to promote collaborative research into the field of long-term interaction of people with AI system, paying particular attention to psychological and cognitive impact once this system, what this system have on children and young people. This is after the implementation of any AI module in the healthcare industry. And the last point in what UNESCO guidelines says is never leave out the vulnerable people. Always take them also, take their opinion, take what they want while developing and making a research, while making a policy in regarding to AI. Engage children and young people in conversation, debates, and decision making. Now, coming to Government of India, right now we do not have any guidelines. What Government of India has taken some measures they have done. First thing, they have made AIMS New Delhi, PGI Chandigarh, and AIMS Rishikesh a center of excellence for artificial intelligence. The aim for this to promote and the use of AI-based solution to health. Government of India, extensively implemented this media disease surveillance thing. And what does it mean? Media disease surveillance system is an AI-driven tool. This scans all the newspaper, details, and then try to identify whether there is an outbreak somewhere. Infectious disease is, chance of infectious disease is going to somewhere, so that the public health system is awakened and necessary measures are taken to prevent or spread of the infectious disease, what is happening now. Right now we have a report of one more Nipah case in Kerala yesterday. So like that, in many places, certain infectious diseases come, which got the capability to erase a high number of people from this earth. So this has done very efficiently since 2022, and it is going on. The results are being studied and the modifications are being done. Another one is clinical decision support system, which extensively talked by my previous speakers. What they have done is clinical decision support system is being imbibed into eSanjeevani. eSanjeevani is a consultation platform by quality streaming of patient complaints and entry into it with the help of telemedicine itself. So they have tried to imbibe this clinical decision support system into eSanjeevani model of care. Apart from that, sector-specific measures to enhance the use of AI healthcare are thus duly being taken by the Ministry of Health. So these are the regulation. I mean, it cannot be a regulation. These are the efforts taken by the Ministry of Health right now in regard to artificial intelligence right now. Soon we expect we are going to have some rule or notification or some rule regulation regarding artificial intelligence in congruence with that of the guidelines supplied by the UNESCO. With this, I think I will end my short talk here because I hope all my previous speakers given the extensive talk on the various things. Thank you.
Thank you very much, sir, for imparting a valuable in-depth knowledge regarding artificial intelligence, ethics and regulations. The flow of your presentation made sense, and really, I hope it may help the audience to understand the depth of the topic, and well explained about what are the regulations we should follow while using artificial intelligence in nursing practice, as well what are the activities so far initiated by various areas like AIMS and other government, what are the steps have been taken. And just one thing I wanted to add up here, ethical consideration are paramount to protect the patient's patient's rights to maintain trust in the healthcare setting. And nursing personnel, as when we work in the nursing service, we must ensure that artificial intelligence advancement, it should align with nursing core values of patient safety and well-being. So what are the ethical principles we learned in the nursing profession? Example, compassionate care, professional intimacy, autonomy, accountability, justice, fair treatment. These all the things should be kept in mind, and there won't be any compromise while incorporating artificial intelligence in the nursing practice. And system failure, we can, many challenges we may arise while incorporating this artificial intelligence in the nursing cadre. Like example, ethical dilemmas. Okay, ethical confusion we may arise. Whether if any problem or mishap happen to the patient, who will take the responsible? Whether the nurse, doctor or human, or whether we will lie the accountable on the machine. But for that answer, American Nurses Association, I read in one article that in 2015, that nurses, because artificial intelligence are not a replacement, they are just a support system. So the nurses are accountable for the practices in instance of system or technical failure. So it is clearly said that nurses or humans will take the accountability instead of any technical or in machine problem. So with that, I would like to conclude, and very nicely spurred his valuable thought. Thank you very much, sir, once again. Thank you.
Education is always an ongoing process and an endless one. I wholeheartedly thank you, Marilyn ma'am, for moderating this session beautifully and adding on to the knowledge that was imparted by Dikhil sir. As we are coming to the end of the program and the webinar, I just want to say that to acquire knowledge, one must study, but to acquire wisdom, one must observe. To know is to know that you know nothing. That is the meaning of true knowledge. A heartfelt thanks to all those who were a source to spread knowledge in everyone who attended today's webinar. Sincere gratitude to the respected dignitaries who participated in today's program, our eloquent speakers, valuable moderators, and most importantly, all those who joined this webinar via Zoom to enhance their knowledge. A big thanks to our Director Sir, CMS Sir, MS Sir, DMS Sir, CNO Ma'am, our guiding pillars, all our Nursing Superintendent Ma'ams and DNS Ma'ams. A big thanks to Mr. Dikhil CD and Mr. Manu for putting their best to make today's program a successful one. A big thanks to the technical team and each and everyone who in one way or the other were a part in the successful completion of today's program. Apology if by mistake I left anyone's name. Thanking all and the Lord Almighty above all, without whose grace and blessing today's program would not have taken place. May the process of education keep on going. May this kindled fire blaze everywhere around you to spread light. Thank you.
Thank you. We will be sharing the post-test and feedback link in the email very soon. You have to do it. Those who complete the feedback and post-test link, will get the certificate after around, within 2 weeks. Please spare some time for us because we are already overburdened us by ourselves. So it will take a minimum of 2 weeks. And if you have not received by 2 weeks, you can contact us back. We will review it and we will ensure that you will get the certificate. Okay. So thank you once again. I once again want to thank Dr. Sujaya Madam and Dr. Webb from the resource faculty who joined from USA. And thank you so much. Special mention to them. And thank you so much. Thank you everybody for your kind listening. Thank you.